Delegates, before we open this morning, I would like to inform the committee that there is a strategic briefing today at 13:10 entitled Primary Healthcare for Universal Health Coverage, from EU commitments to country implementation. Details on how to connect
Recording
may be
in
found
progress.
in the daily journal. We will now return to the grouping of Agenda Item 17, Public Health Emergencies, Preparedness and Response, and 18, Mental Health Preparedness for and Response to the COVID-19 pandemic under Pillar 2, 1 billion more people better protected from health emergencies. You will recall that yesterday we opened and suspended two discussions under these agenda items. The first on the technical update and update on the COVID-19 response, and the second, the update from the Independent Panel on Pandemic Preparedness and Response, co-chair as well as the chair of the Independent Oversight Advisory Committee for the World Health Organization Health Emergency Programs, and the Review Committee on the functioning of the International Health Regulations 2005 during the COVID-19 response, as well as implementation of the International Health Regulation 2005. We will now resume our discussion on the second grouping, the update from the Independent Panel on Pandemic Preparedness and Response co-chair, as well as chair of the Independent Oversight Advisory Committee for the World Health Organization Health Emergency Programs, and the Review Committee on the functioning of the International Health Regulations 2005 during the COVID-19 response, as well as implementation of the International Health Regulation 2005. When we suspended this discussion yesterday, there were still a number of member states wishing to take the floor. If you still wish to take the floor, you will need to raise your hands again now. I remind delegates that under this grouping of agenda items, 4 minutes are allowed for a statement by member states, as well as for regional statements. As I indicated yesterday, I have instructed the moderator to please interrupt member states who go beyond the 4 minutes. I would now like to give the floor to the moderator to manage the list of speakers. Moderator, you have the floor.
Thank you, Madam Chair. I would like to invite the delegation of the Philippines to take the floor, followed by the delegation of China.
The Philippines recognizes the evolving nature of the scientific
The
evidence.
delegation of the Philippines, can you kindly speak loudly and unmute?
The evolving nature of the scientific evidence for emergency preparedness and response in the face of these obstacles. This report by the IOAC is a valuable step forward to achieve the goals of improved emergency risk reduction and response. We call on the WHO to contextualize the report's recommendations and the experiences and needs of the Global South to make this report meaningful. The pandemic-proofing the supply chain, especially for low and middle-income countries, providing appropriate digital solutions to countries with poor IT infrastructure, and ensuring that technical advice provided by country offices is followed through with actionable ways forward are but a few concrete steps that we can take to ensure that no one is left behind. So that the implementation of our commitments to the international health regulations should also strengthen country surveillance systems. The Philippines calls on the WHO and all national focal points to craft guidelines and platforms that will make information sharing among member states easier. We call on the WHO to take further steps in empowering NFPs to develop and implement national action plans built on recent learnings and more responsive to future public health emergencies. Further, we call on the WHO to facilitate response to requests for information aligned with national data privacy laws and to strengthen case detection and contact tracing between borders. The integration of mental health in preparedness and response also calls for a re-examination of many of our assumptions in the provision of mental health services. The provision of these services should be community-based, community-centered, and multidisciplinary, and vulnerable populations such as frontliners, women, and underserved should be prioritized and protected. To end, the Philippines fully supports the endorsement of the updated Comprehensive Global Mental Health Action Plan and calls on member states to implement this plan soon. Thank you.
Thank you to the Philippines. I would now like to give the floor to China, followed by Sudan.
Thank you, Madam Chair. China thanks the chairs of the IPPPR, the IOC, and the IHR Review Committee for their reports. China also thanks the three panels for their tremendous efforts since last year and their constructive recommendations to prepare the world for the pandemic for better.
所做的大量的工作表示赞赏。中方认为，疫情关于构建统一健康监测系统的理念，以及全社会、全政府的疫情应对模式
and whole of society response approach and supports the improvement of the international health regulations and other international legal systems. Second, China believes that promoting equitable distribution of and access to COVID-19 vaccines worldwide is crucial to the current pandemic prevention and control. China has honored its commitment of providing vaccines as a global public good and has provided vaccine assistance to more than 80 countries and exported vaccines to 43 countries and supplied 300 million doses of vaccines globally. China will continue to make its own contributions to promoting the accessibility and affordability of vaccines in developing countries.
To begin your statement from the beginning, so that we can have interpretation throughout the full statement. Can you kindly restart your statement from the beginning?
谢谢主席，谢谢主席。中方感谢 IPPR 主席、IOC 主席。
Thank you, Madam Chair. China thanks the chairs of the IPPPR, the IOC, and the IHR Review Committee for their reports. China also thanks the three groups for their tremendous efforts since last year and their constructive recommendations to prepare the world for the pandemic for better response. China thanks the Secretariat for its report on the implementation of the International Health Regulations 2005 and appreciates the tremendous work done by the WHO Secretariat. China believes that the virus knows no borders and the epidemic knows no races. Building a community with a shared future for mankind requires global solidarity and cooperation. China agrees with the concept of building a One Health surveillance system in the relevant report, as well as a whole of government and whole of society response approach, and supports the improvement of the international health regulations and other international legal systems. China believes that promoting equitable distribution of and access to COVID-19 vaccines worldwide is crucial to the current pandemic prevention and control. China has honored its commitment of providing the vaccines as a global public good and provided vaccine assistance to more than 80 countries, exported vaccines to 43 countries, and supplied 300 million doses of vaccines globally. China will continue to make its own contributions to promoting the accessibility and affordability of vaccines in developing countries. China has noted that the relevant reports call for the establishment of a new international expert investigation mechanism and a national capacity review mechanism. China generally agrees with the direction recommended in the reports. However, we stress that the new mechanism must follow the basic principle of sovereign equality, be based on consensus with relevant state parties, and require dedicated study and consultation. China has also taken note of the recommendations of the Global Health Threats Council. China holds an open attitude and is ready to work with the international community on the study. Thank you, Madam Chair.
Sudan, followed by Ghana.
Thank you, Chair. Sudan welcomes the updated report prepared by the Independent Panel for Pandemic Preparedness and Response. We strongly agree with several concerns raised by panel and highlight the need to firmly address inequalities to ensure we come out of this pandemic more resilient with sustainable responses to health emergencies. Immediate actions to end COVID-19 must be clearly planned and executed with the support of the pivotal political commitment from member states. As this pandemic has shook the entirety of the world's health systems without any discrimination, it has advertently impacted health systems in low-settings countries and further widened the gap in health service delivery. While Sudan is committed to playing its role in the global effort for control and prevention of public health emergencies of international concern, challenges remain. This is observed in the difficulties to regularly evaluate available legislation, regulations, and policies to facilitate full IHR implementation, as well as in low capacity for infection prevention and control, and chemical radiation and decontamination. Sudan calls on WHO to assist in developing advanced training on analytical capabilities with sophisticated techniques for detection and rapid assessment for chemical events and environmental pollution. We call on WHO to provide technical support to assist in establishing public health laboratories in difficult states with modern equipment and distinct consumable supply, to also help in establishing food safety surveillance systems and a poisoning control center. Sudan welcomes and commends the report presented by the chair of the IOC for the WHO Health Emergencies Program. While the COVID-19 pandemic has brought to light the inadequacy of health emergencies program to tackle a global pandemic while simultaneously managing concurrent health emergencies, it has cemented and strengthened WHO's leadership positions while concurrently shedding light on the importance and efficiency of global solidarity to take on this pandemic, as the way forward undoubtedly lies in multilateralism in order to prepare together for any future pandemic through strengthening partnerships with member states and global communities. Sudan acknowledges the effort exerted by the WHO program in establishing WHO's information network for epidemics for COVID-19, which leverages existing networks. Drawing global attention to the critical importance of properly funding risk communication programs in order to be treated as an essential component of epidemic management, particularly if we took into account the current social mess circulating in COVID-19 variants, which shed light on the important fact that the response to risks such as pandemics does not solely hinge on governmental responses or preparedness, but also greatly depends on the people's risk perceptions and subsequent risk behaviors. In order to be better prepared for any future risks or emergencies, public health institutions and governmental entities must develop effective risk communication methods that are grounded in theory and conducive of position risk behaviors to ensure that the public is adequately equipped to face these fallacies. Finally, Sudan aligns its position with the several recommendations presented by the committee. We call on WHO to provide support to ensure the in-depth implementation of health measures in the face of these new variants. We strongly support the call for WHO's Secretariat to support politically unstable countries and conflict-affected areas in the provision of the essential health services, as health has the potential to be used as a bridge for peace, and the provision of these services will alleviate some of the suffering of the people living in conflict-affected areas. I thank you, Chair.
Thank you, Sudan. I would now like to give the floor to Ghana, to be followed by Thailand.
The statement made by Togo on the implementation of International Health Regulation 2005 on behalf of the 47 member states of the WHO African region. The WHO Health Emergency Program and other stakeholders for spearheading the agenda of International Health Regulations 2005. Ghana recognizes the implementation of IHR to be the driving force in establishing the requisite capacities towards assuring health security. In capacity at the point of entry, Ghana is instituting the following measures: a need assessment of all points of entry to determine their infrastructure gaps, We implemented a nationwide electronic surveillance system known as SORMAS. We roll out of nationwide antigen testing and increased participation of private laboratories in testing for SARS-CoV-2. To establish mobile laboratories at selected points of entries, and staffing has also been increased. Recommendation to integrate the core capacity of emergency preparedness, surveillance and response within the broader health system and essential public health functions to ensure resilience of national health systems to effectively address pandemics and other health emergencies. We agree with WHO on the need to develop standards to produce a digital version of the international certificate of vaccination and prophylaxis in consultation with the state parties and partners. An urgent priority is for WHO to study issues relating to digital vaccination certificates such as mutual authentication and data security. They adopted the following electronic system at its airports: e-health declaration. In conclusion, Ghana advises state parties to comply with Article 43 of the IHR when implementing additional health measures that restrict international traffic by following strictly adhere to instant requirements of the measures and the public rationale for them.
Thank you, Ghana. I would now like to give the floor to Thailand, followed by Jamaica.
Thank you, Chair. Thailand echo statement made by South Africa on the way toward WHO Convention, agreements or other international instruments on pandemic preparedness and response. And we would like to put spotlights on two major gaps and challenges revealed by COVID-19 crisis. Firstly, inadequate capacity of the WHO for effective health emergency preparedness and management. Among of our major concerns, this includes sustainable financing for the WHE program, staff capacity and efficiency of administrative processes. While Thailand supports the draft decision and the role of the WHO in compliance with the temporary recommendations under the IHR 2005, we would like to encourage the engagement of state parties and partners to proactively and collectively reach a mutually acceptable solution under the Article 43. Secondly, Chair, Thailand registered our concern on the underinvestment for national IHR core capacity. National IHR focal points must be empowered, funded, and better managed to ensure its active engagement and coordinate with other sectors, especially security entities. Outbreak response must be evidence-based, guided by epidemiological information. WHO normative function is developed. International guidance is totally crucial. With scarce WHO resources, Thailand suggests that role of responsibility of newly appointed technical advisory of group of experts on infectious hazards should not overlap with other existing technical bodies. Lastly, Thailand expresses grave concern over inequitable access to vaccine, medicine, and supplies. We would like to reiterate IPPR recommendation to establish stronger regional capacity for manufacturing, support technology transfer, and facilitate voluntary licensing, because we truly believe that no one is safe until we all are safe. Thank you.
Thank you, Thailand. I would now like to give the floor to Jamaica, followed by Egypt.
Here, as a co-sponsor of the resolution WHA 73.1 on the COVID-19 response, Jamaica thanks the GEG for its reports under this agenda item, in particular for the work undertaken towards its implementation. Jamaica acknowledges the WHO's role as a leading and coordinating organization in the field of health. We are therefore grateful for the efforts of the WHO under the able leadership of the Director General in assisting countries to respond to the COVID-19 pandemic at the global, regional, and national levels. Undoubtedly, the delivery of essential health services has been severely impacted by the pandemic. There also continues to be unequal implementation of the International Health Regulations, 2005. Chair, it is therefore critical that the WHO continues to support countries to strengthen their health systems to prepare for and to respond to pandemics such as COVID-19. We therefore express gratitude for initiatives such as the Health Services Learning Hub, the Boost Initiative, just to name a few. Chair, in order to mitigate the impact of the pandemic, it is evident that countering misinformation and disinformation is the only way to overcome this infodemic that we are faced with, which has resulted in vaccine hesitancy, among other challenges to achieving herd immunity. The development and dissemination of normative products, technical guidance, and other publications are vital to this process. Chair, Jamaica would also like to place on record its appreciation to the IPPPR, IOAC, and the IHR Review Committee for the reports and key recommendations. We have taken note of the recommendations, including to establish a new international treaty for pandemic preparedness and response. In this connection, we look forward to continued discussions on these issues. Relatedly, the work of the open-ended working group in considering the findings and recommendations of the various review bodies will be of significant importance to this process. Chair, in closing, Jamaica would wish to thank the EU for its leadership on the resolution strengthening WHO preparedness for and response to health emergencies, and we are pleased to confirm our co-sponsorship of the draft under this agenda item. A stronger WHO will lead to greater resilience to health emergency, and no one is safe unless we're all safe. I thank you.
Thank you, Jimmy. I would now like to give the floor to Egypt, to be followed by Indonesia.
Madam Chair, ladies and gentlemen, good afternoon. First of all, I would like to thank the independent panel on our pandemic preparedness and response, the IPPR, and the IOAC and the Review Committee, and we welcome the reports and the recommendations contained therein. We would also like to welcome the efforts of the organisation in dealing with the pandemic. And we'd also like to thank it for its support to Egypt. Egypt has established a comprehensive preparedness plan to respond to the pandemic. It's also been establishing and implementing a plan to promote emergency response. We also have a plan in place to respond to all of the elements of the IHR and increase national capacity. We can see that there is a very important objective involved in establishing an international treaty for pandemic response. This will help to build national capacity and global capacity to help the world deal with pandemics in the future. This will also help us to deal with the pandemic in a peaceful and cooperative manner. We also hope that this treaty will be based on the principles of the Constitution of the WHO, enshrining the principles of health for all. For example, the international health regulations will help to support this treaty, and we'll be able to build on that further later on. We support all member states in these efforts, and we are fully committed to the international health regulations. The idea of this treaty is to bridge the gaps that have been laid bare by the coronavirus pandemic, as well as making the most of the knowledge that's been gained throughout this process and promoting international solidarity and building capacity at the national and regional and international level. It's also important to make the most of the available treatments and detection tools, and we support these efforts to support global and national capacity. With regard to the draft resolution proposed by the EU, strengthening the WHO preparedness for and response to health emergencies, this draft resolution has shown the importance of various different issues. The WHO needs to play a key role in these international efforts. And this role can be strengthened, as well as promoting multilateral cooperation in the field of health. It's important to develop a broad United Nations system-based system. On the basis of those important principles, which involve improving and reinforcing health systems all over the world, we support the draft resolution. And we support all efforts to support the WHO as the leading organization in promoting health all over the world. Thank you very much.
Thank you, Egypt. I now give the floor to Indonesia, to be followed by Colombia.
Our task includes how to make such recommendation coherent to our One Health approach and commitment to a better future. The question now is not how and what to do, but when to do it. For Indonesia, the answer is no. We should act now and act together collectively. Disparities between high-income and low-income countries have become more apparent in the mitigation of this pandemic. We could not let the persistent socioeconomic inequalities widen. We need to act now to better our national, subnational, local, regional, and global preparation for further health needs. Chair, allow me to share some pertinent propositions on how we can work together for a better preparedness. First, following up the panel's call to increase the equitable access and the availability of the tools, and working with all relevant public and private partners rapidly to share existing products, including vaccines through programs. Using all available capacities to increase global supply and distribution to support pandemic response by promoting the application of more voluntary licensing agreements of intellectual property, including patent pooling as well as technology and knowledge transfers. Second, building a better early warning system and network to enhance global resilience by improving national, regional, and global capacities to monitor and promptly detect potential health emergencies. Strengthening local focal points system to ensure rapid data and information sharing. Encouraging a fair and equitable benefit sharing to all countries to facilitate and fulfill the need for rapid sharing of pathogens, specimen, and surveillance information, as well as the use of the development of countermeasures. Third, we should all become catalysts. Global cooperation is a must. Indonesia will continue to garner more countries to work together collectively to support the WHO global pandemic preparedness. Thank you.
Thank you, Indonesia. I now give the floor to Colombia, to be followed by Argentina.
Thank you, Madam Chair. We would like to thank the co-chairs of the independent panel and the committees and experts for the valuable reports and recommendations. We recognize the cross-cutting work that's been done by the IPPPR based on evidence, as well as its approach focused on strengthening coordination at the highest levels of the political realm. Nevertheless, we must not forget that preparation and response must also be supported by strong health systems. The reporters have laid bare the worrying challenges that are represented by unequal access to diagnostics, therapeutics, and vaccines against COVID-19. This inequality is represented in middle and low-income countries, as well as vulnerable populations such as migrants and refugees. Therefore, it's necessary to mobilize resources urgently, as well as build and set up strategies that are focused on strengthening local production and increasing production of medical countermeasures. We welcome the fact that these concerns are reflected in the report, and we urge the WHO and other relevant agencies to continue this priority, developing work towards this priority objective. With regard to the IHR, we recognize that these are an essential tool, but their implementation is insufficient and there are enormous gaps. Therefore, mechanisms to promote the compliance with these instruments through legal frameworks and independent monitoring mechanisms could help to generate incentives for cooperation and strengthen preparedness and response to emergencies. Therefore, we support the recommendation submitted to by the committee on the need to periodically examine legislation in force and ensure that the relevant legal frameworks are in place to implement the IHR and to make sure that sufficient resources are available to finance these measures. Furthermore, it's necessary to develop and strengthen expert networks at the regional and global level to strengthen capacity to apply the IHR. We urge the organization to continue developing instruments and technical guidelines to help work towards this end. Madam Chair, the pandemic has shown the need to act swiftly. We therefore agree with the suggestion to act under the principle of precaution and swiftly share information with WHO and with countries and facilitate coordination and response. It's also necessary to have the relevant mechanisms in place to verify situations and monitor the development of public health situations. We underline the need to use the relevant technological tools available to set up communication and promote early warning systems. Faced with enormous failures in terms of preparedness and response, we reiterate the call of the organization and the IHR committee to carry out external evaluations and self-assessments of basic capacity and continue carrying out the national action plans. It is also necessary to ensure that there is assistance from the WHO. Specifically, designing procedures and protocols to implement these plans is particularly important. These should also be tested regularly with simulations and practical exercises. We also underline the need to have standardized procedures at the international level to ensure, with regard to free pratique, and we urge the organization to promote this process and make progress on procedures to certify entry points as referred to in the IHR. We also agree about the need to strengthen the wall of national focal points to coordinate with the WHO at all levels. The challenge will be ensure that all of the recommendations are implemented and the roadmap is implemented as we prepare for new challenges and as we reopen the world after the pandemic. Many thanks.
Thank you, Colombia. I now give the floor to Argentina, to be followed by Brazil.
Thank you very much, moderator. Thank you, Chairman. We are grateful for the reports and the updates on these agenda items, and particularly for the recommendations made by the committees and the panel. The COVID-19 pandemic is one of the greatest challenges which mankind has ever had to face recently. It's highlighted as never before the social inequities in the world, the health, economic, and other impacts within and between countries, and shown up our most vulnerable points. Argentina agrees that many of the weaknesses which have been noted in the response to the COVID-19 pandemic are through inequality in health systems as a reflection of social and economic inequalities, a lack of financial investment, failure to comply with specific obligations stemming from the IHR, and particularly in respect of preparation, insufficient international solidarity and cooperation, a reduced and over-concentrated production capacity when it comes to vaccines and a lack of sustainable financing for WHO, particularly in the area of emergency preparation, and this is not an exhaustive list. We would like to reiterate Argentina's commitment to efforts to strengthen the global system of preparation and response for health emergencies and the application of the IHRs 2005. They need to be developed, and we need to maintain our basic capacities and ensure full integration of one's national health system into universal health care and universal health coverage. Argentina is willing to debate and consider new tools and strategies based on international solidarity and cooperation, including the possibility of a pandemic treaty. We will participate constructively in the working party to be set up through the resolution on strengthening WHO for health emergency preparation and response, and in the special session at the end of November, which will be based on the decision to be taken on the point. We appreciate the fact that there has been an intergovernmental process to tackle this issue and consensus reached on the basis of it. But we also think we need to analyze recommendations and the lessons which we should be learning from the pandemic. We believe that the possible adoption of an international treaty on pandemics will require adjustments to national legal systems and provisions. Furthermore, a measure of this kind, if it's going to be systematically effective, must be the fruit of a consensus among the member states of WHO. We think this would be an excellent medium and long-term measure to strengthen the system. However, we need to underscore the fact that the pandemic is not yet over. Countries' efforts at the moment to meet the challenges we still face are being hampered by inefficient and equitable access to COVID-19 vaccines. There is a need to increase their production using all available capacity, including those in Latin America, to bring the pandemic under control. In conclusion, we would like to thank the European Union and the group of friends of the treaty, respectively, for the efforts they've made and the leadership they've shown in the course of negotiations to agree a consensus-based text on both the resolution and the decision. Thank you.
Thank you, Argentina. I now give the floor to Brazil, to be followed by Andorra.
Systems around the world. As noted by the IPPPR, it is the worst combined health and socioeconomic crisis in living memory, and a catastrophe at every level. Brazil is studying carefully the reports published by the Independent Panel on Pandemic Preparedness and Response, the Independent Oversight and Advisory Committee of the WHO's Emergency Program, and the Review Committee of the International Health Regulations. We do note the important role that will be played by the open-ended working group on strengthening WHO preparedness and response to health emergencies, on considering the recommendations. Brazil looks forward to engage constructively and meaningfully in this exercise. It is important to highlight that all reports present as their main message the need to work together to end this pandemic and prevent future ones. Bearing this in mind, Brazil joined the ACT Accelerator to help develop vaccines, treatment, and diagnostics against COVID-19 and promote their equitable distribution. ACT A's vaccine pillar, the COVAX facility, has been central to promote worldwide immunization. To truly end the pandemic, however, we need to strengthen technical cooperation and promote technology transfer. Brazil has signed technology transfer agreements with international pharmaceutical companies, and we will soon be ready to offer additional vaccine production capacity to help achieve this goal. Brazil is paying close attention to discussions at the WTO on intellectual property rights waivers and flexibilities, and we advocate that immunization against COVID-19 should be considered a global public good for health. So far, Brazil has distributed more than 90 million doses and applied more than 63 million vaccines, among which 80% in indigenous people. We are positive that our immunization efforts, together with non-pharmaceutical measures, will control transmission, halt deaths, and promote economic growth. We support the recommendation to maintain greater engagement against public health emergencies, strengthening the development of countries' core capacities for surveillance and response. Brazil has been investing in the expansion of its health surveillance network, adding 74 new surveillance centers to an existing network of 55 centers. We also support discussions about the convenience and timing of an international framework or other international instrument that takes into account the WHO's reform processes, in particular its leadership role in combating health emergencies, and the central role of the international health regulations. It is essential that the negotiations, once launched, foresee an adequate timeframe to allow for consensual advancements. Brazil also supports efficient mechanisms for sharing information, reinforcing the important role of the national IHR focal point. Thank you.
Thank you, Brazil. I now give the floor to Andorra, to be followed by Chile.
Thank you, Chairman. Andorra is grateful to the Chairman for giving us the floor. We would like to thank the committees and the working groups and parties for the very hard work they've been doing to produce the detailed and complete reports we have, with their conclusions and recommendations to be reached and followed to make sure this pandemic really is the last one. We would like to highlight the importance of strengthening the WHO's emergency preparation and response system, as well as the importance of strengthening the implementation of the IHRs at all levels and in all countries. We are grateful for the intense work which has been done by the co-sponsoring delegations, those which have participated in developing the resolution on strengthening WHO's pandemic response. We also support the decision proposed to analyze the benefits of a legal instrument for that purpose. As we understand, its results will be submitted to the special WHA next November, and we would like to be considered as a co-sponsor of both initiatives. We firmly defend multilateralism as a way of solving the problems which affect us all, and because of that, we've joined the COVAX platform. More equitable access to vaccines, diagnostics, treatments, and strengthening of the sustainability of health systems globally are sine qua non for achieving the 3 billion target. We are very different countries, of course, in terms of size, resources available to us, culture, and so on and so forth. The need for more human resources and the limits on them and on equipment and material available for small countries, in particular on all 5 continents, needs to be taken into account, because sometimes it is difficult to implement decisions and resolutions precisely because of our size. Thank you.
Thank you, Andorra. I now give the floor to Chile, to be followed by Ecuador.
Thank you very much. Ladies and gentlemen, Chile very much appreciates the continuing efforts being made by WHO and its Secretariat to help bring the pandemic under control. Obviously, for over a year now, it's been causing very serious health consequences across the world. Last May, Chile supported the resolution on COVID, in which a progressive, impartial, independent, and exhaustive system of evaluation of WHO's pandemic response is provided for. We are grateful for the work of the IAOC, the IHR Review Committee, and the IPPR, and we take note of the recommendations contained in the respective reports. Turning to the recommendations on the national focal points for the IHRs, Chile would like to express her support that those must be financed and positioned with specific status and authority within the government structure to be able to participate in a significant manner. We support the recommendation for training and workshops to be provided and held by WHO for the focal points, so that they can be strengthened in terms of responding to possible future public health emergencies. We also appreciate the proposal to have WHO develop a mechanism for states party to use so that they can in real time and automatically share information related to the emergency, including the genome sequencing that WHO needs to evaluate the risks. Furthermore, we consider it essential that WHO have the capacity to enable it to publicly share the information it has available. This will make it easier for states to take quick decisions on health measures to protect the population which may be affected by any emergency. To achieve this, we need to work together with WHO to evaluate and implement such recommendations. The final goal would be to strengthen the global health architecture. We would also underscore the reference in the reports to the need for an international treaty on pandemic preparation and response. Since the first months of this health emergency in May last year, Chile has been promoting this idea of a global pandemic treaty. And a year later, we see that the world is now looking more positively on this initiative. Today, the WHO will adopt a decision calling for a special WHO session at which such an international instrument can be developed. Chile supports South Africa's proposal and would like to thank all states for their efforts to make sure that this decision becomes a reality. We urge that the necessary work to make headway on an international instrument relating to pandemics be continued, and we are very grateful to our experts who have been working a very long session on this. We would like to see transparency, inclusion, solidarity, and cooperation as our work goes ahead on the 4 pillars. In a globalized world, one of the threats we're going to no doubt face again is a new pandemic or health emergency. Therefore, we need to be prepared to respond globally on the basis of a strengthened global health architecture and learning from the experiences we've had during this pandemic. We hope cooperation and multilateralism will enable us to overcome together the present emergency and any health challenges which will arise in the future. Thank you.
Thank you, Chile. I now give the floor to Ecuador, to be followed by Algeria.
Thank you very much, Chairman. Ecuador would like to thank the groups for the reports that they have presented. We are aware that this pandemic has taught us that it is crucial to step up and enhance our preparedness for and response to international health emergencies. We are happy to see the presentation of relevant information on the application of the IHRs in particular, as well as an update of other things such as advice on international transport and travel certificates, and guidance on what to do at international and regional border crossing posts. We believe that the report from the IPPR is particularly helpful because it carries out an extensive analysis of weak points in the response chain. We agree entirely with what has been said by the experts on many points. We would also like to support the panel's recommendations on ensuring that pandemic preparation and response is tackled at the highest possible political level. The financing and strengthening of WHO must also be guaranteed if we're going to avoid the next crisis, and that includes considering new international financing for pandemic preparedness and response. Like other delegations, Ecuador has had to tackle this pandemic with limited resources. Nonetheless, we have provided a reasonable response to COVID-19, and we have included humanitarian measures which have had to be taken and observed the humanitarian standards set for international response. We've been working very carefully with our in-country teams so as to strengthen our health sector. That is all aspects of it, and that includes boosting capacity of our health staff and ensuring that drugs, medicines, and medical equipment are provided to make more beds available for care, and that list is not exhaustive. We have also implemented various programs to promote health and provide social protection, and we feel that they have directly contributed to mitigating the negative impact of this pandemic on those most vulnerable population groups. We have, for example, provided social financial transfers which have benefited 1 million Ecuadorians. We would like to reiterate our commitment to continue to strengthen what is provided for in the international health regulations and strengthen those regulations indeed. And we encourage other countries to take coordinated action and joint response at local, regional, and global levels. These will contribute to the sustainable development of the regulations. We would also like to offer our endorsement to the decision to convene a special session of the World Health Assembly, which will consider the preparation of an international treaty, agreement, or instrument, whatever you call it, on WHO pandemic preparedness and response. Thank you.
Thank you, Ecuador. I now give the floor to Algeria, to be followed by Germany.
Thank you, Madam Madu. With the statements of the Africa region on item 17, I would like to deliver the following combined statement in its national capacity. More than a year after the outbreak of COVID-19, Algeria believes that the lessons learned from this major crisis should contribute to the improvement of global preparedness and response to health emergencies, both at the normative and operational level. In this regard, we commend the IOAC of the World Health Emergency Program, the IHR Review Committee, and the IPPPR for their respective evaluation reports on COVID-19 response and the recommendations contained therein, just as we reiterate our appreciation of the international initiatives like CETA and the ICT Accelerator, including COVAX, for sharing and pooling knowledge, strengthening health capacities, and procuring medical equipment and vaccines. As the world has bitterly experienced, COVID-19 is a multidimensional crisis. The international community is therefore called to find a multidimensional solution, which should be based on the principles of solidarity, equity, transparency, and inclusiveness. In this vein, and to echo the opening address of Dr. Tedros, the global solution should go beyond the strict framework of health in order to include other key and cross-cutting issues, such as intellectual property, access to health technologies and products, and their local production, since COVID-19 has demonstrated irrefutably that they are vital for the prevention and containment of global health emergencies. Against this backdrop, Algeria reaffirms its readiness to continue contributing constructively to the regional and international efforts to meet the historic challenge posed by this pandemic, including within the existing working groups and the settings foreseen in the relevant draft resolutions and decisions on the agenda of the current World Health Assembly. The question is not if, but when the next global disease will arise. Therefore, whatever the final outcomes of the current and incoming initiatives, there is no doubt that the world will have to be more prepared. Thank you for your kind attention.
Thank you, Algeria. I now give the floor to Germany, to be followed by Spain.
Thank you, moderator. Germany aligns itself with the statement by Portugal on behalf of the EU and the statement by South Africa on behalf of the co-sponsors of the decision for the development of a robust global agreement on pandemic preparedness. In our earlier statement yesterday, we said that we were currently experiencing a once-in-a-lifetime crisis, pandemic. This was only partly correct. While we all hope to never again experiencing such a global health crisis, the IPPR has clarified that a new dangerous virus could emerge at any possible moment in time. Indeed, the world was hit by this virus unprepared. And if another virus emerged tomorrow, this would still be the case. We have to put it bluntly. The status quo of pandemic preparedness is unacceptable for all of us. Therefore, we have to do our utmost to learn from the past and present for the near future. Doing so, we have to realize that so far, we were all unable to learn from past health crises, because we failed to create and build upon the needed political momentum for change. The good news is, it lies within our own hands and responsibility, whether we take action, change the status quo in pandemic preparedness, and thereby ensure that the current crisis remains a once-in-a-lifetime experience. We sincerely thank the different independent panels for their clarity of what needs to be done by us member states. You have outlined the menu of global health preparedness. You have done an outstanding job in a very short time frame. You have done all that lay in your responsibility, namely to present to us and to make it crystal clear to everyone what needs to change in order to best prepare the world for future health threats. It would be helpful if the IPPR would continue to engage until the special session of the World Health Assembly in autumn. Now it is up to us member states. It is our responsibility to agree that we have to overcome our comfort level and to profoundly change the way we have engaged in global health preparedness so far. Fundamental changes, including investments, are needed. However, fundamental changes are a challenge for us member states, as we always have the tendency to jointly adhere to what we have done in the past. We member states often feel at unease if we are moving away from the status quo. This is why we were unable to implement past recommendations after past global health crises. Therefore, it is a groundbreaking signal that a consensus has been reached on a special session of the World Health Assembly in autumn, with a view to establish a process for robust global agreement on pandemic preparedness. And it's a clear signal that 59 member states explicitly co-sponsor the relevant decision. This shows, in the face of this pandemic, there is a broad consensus to move beyond mere rhetoric and to take concrete action. A robust global agreement, as proposed by all independent panels, will establish the needed framework for a safer world in the future. Green light for this treaty process is the greatest commitment to learn from this crisis that this assembly could have sent out. It is the most effective way to make sure that this global health crisis becomes the final one. Thank you.
Thank you, Germany. I now give the floor to Spain, to be followed by the Bahamas.
Thank you very much, Moderator. Chairman, distinguished colleagues, Spain supports the statement delivered by the European Union on behalf of its member states. We also support the interregional statement on the pandemic treaty made by South Africa. We note the reports submitted and support the point for decision under agenda item 17.4. We are aware of the immense amount of work on review and analysis that lies behind these evaluations. Conclusions and recommendations are now on the table. The important thing is to act at this stage. Our experience in managing COVID-19 has made it clear that greater political and policy coordination are crucial. For better preparation, we need a more thorough risk analysis and better early warning mechanisms. It is also key that we ensure more effective response involving all parties affected. Spain is already working on a new state public health center and an updated surveillance network. It's up to all of us to develop and support international mechanisms which are effective and facilitate for countries access to the necessary tools and material and equipment to fight pandemics. We believe that negotiations on the pandemic treaty should start as soon as possible. We think the special WHA in November would be an excellent moment for doing precisely that. The situation is urgent and we cannot dawdle in adopting decisions. We urge WHO's member states to support this international agreement, which we endorse 100%. We are convinced that the treaty will be a complement to and improve the enforcement of the international health regulations. We would like to see a strengthened and renewed WHO, which can embark upon a process for strengthening the global health system in its entirety, so that we can get tangible results in a reasonable time for everyone, and that means involving states at the highest level of governance. The expert reports we already have and which will come have shown us where the most shocking shortcomings have been, and we would like to explore other high-quality recommendations to achieve a consensus on what needs to be done. Spain wants to and will support increased contributions, more flexible contributions to WHO. We firmly support universal access to products against COVID-19. We support the ACT Accelerator and COVAX, and we have a national plan on solidarity and vaccines for all. In communication with CTIP, we have been promoting innovation in Spain on diagnosis, and we urge that it be distributed through open license. If we have further comments, we hope for the opportunity to make them. Thank you.
Thank you, Spain. We now give the floor to the Bahamas, to be followed by Singapore.
Madam Chair, the COVID-19 pandemic has underscored the risk of international and local spread of disease, a priority concern for the Bahamas. The international health regulations have been a guiding mandate for national interface on public health threats posed in the international sphere. Enhancement in preparedness for health emergencies have occurred since the entering into force of IHR 2005. Designation of a national focal point, monitoring and sharing as appropriate, alerts received through the EIS, while strengthening IHR core capacities and adhering to reporting and compliance mechanisms have bolstered health emergency response preparedness. Madam Chair, the first case of COVID-19 recorded in early March 2020 marked our first wave. Low numbers attributed allowed ease of managing IHR responsibilities. The second wave, however, challenged surveillance and health system capacities. With the increasing burden of COVID-19 cases, implementing technological solutions and augmenting human resource capacities for enhanced monitoring and response has further strengthened preparedness. However, sustained surveillance and response, delivery of routine health services in tandem with COVID care delivery and COVID-19 vaccination amplification strains the health system environment fraught with healthcare provider multitasking and a depleted health workforce, particularly in nursing. Madam Chair, the Bahamas notes key messages of the Review Committee and recommendations for urgent attention. Elevation of health emergency preparedness and response through strengthened legislation and dedicated funding for enhanced surveillance and response integration within the broader health system and essential public health functions are in train. Madam Chair, the Bahamas notes the call to establish a new international treaty and the importance of solidarity. We urge the WHO to continue its work with strengthening NFP capacities with clear guidance on the NFP requirements of IHR, taking into context resource disparities across member states. I thank you.
Thank you, Bahamas. I now give the floor to Singapore, to be followed by Madagascar.
Thank you, Chair. Singapore acknowledges and appreciates the work of the IPPR IOAC and the IHR Review Committee. We wish to contribute 3 further reflections. First, the IPPR's recommendations for reforming the WHO should be considered seriously. The WHO has a central role to play as the UN agency with a mandate to act as the directing and coordinating authority on international health work. It is in member states' interest that the WHO has the necessary resources to carry out its mandate in global health, because a healthier world is a safer world for all of us. Singapore is co-sponsoring the resolution on strengthening WHO's preparedness and response for health emergencies. Secondly, the IOAC has recognized the improved decision-making and communication across all three levels of the organization to increase surge capacity response to COVID-19. In the Western Pacific region, Singapore has supported fellow member states by providing diagnostic testing of samples as an appointed WHO reference lab. We commend the Western Pacific Regional Office for strengthening testing capacity in our region, especially for areas which were previously solely reliant on global referral systems for testing. Finally, the IHR Review Committee has recommended for WHO and states parties to consider the benefits of developing a global convention. Given its long-lasting implications for the world, any proposed future international instrument will require the broad-based support and commitment of all member states. Importantly, aside from having a convention, agreement, or other international instruments, it's equally important for all of us member states, to invest in our own public health capabilities and capacities. Thank you, Chair.
Thank you, Singapore. I now give the floor to Madagascar, to be followed by Cuba.
Thank you, Madam Chair. Madagascar endorses the statement of Côte d'Ivoire on the COVID-19 response, on that of Togo on the international health regulations on behalf of the region. We also would like to congratulate the Secretariat on the quality of the report. Just like any country in the world, Madagascar has been severely impacted by the pandemic. Madagascar, like many other African countries, is suffering from the effects of recent variants, which are also compounding the effect of other contagious diseases. We are currently facing a second wave of the COVID-19 pandemic. Over the past 4 weeks, however, we have had a sustained reduction in the number of positive cases. Swift, rapid response measures were taken to combat the pandemic.
L'évolution de l'épidémie. Le diagnostic biologique a été renforcé avec
Diagnostics have been strengthened, and we've been using various types of tests to ensure we detect cases of COVID-19. Healthcare for COVID patients has been improved, particularly through the acquisition of equipment, including oxygen equipment and ventilators. The interpreter apologizes, the sound quality is insufficient.
Avec la perspective de la mise en place d'une agence de
for
médicaments
interrupting Madagascar. Unfortunately, we're experiencing issues with the sound quality for interpretation. Can I ask you to kindly come closer to your mic and to begin again?
Oui.
Thank you, Madam Chair. Madagascar endorses the statement of Côte d'Ivoire on the COVID-19 response and that of Togo on the IHR on behalf of the region. We would also like to congratulate the Secretariat for the clarity and the quality of the report. Just like every country in the world, Madagascar has not been spared from the effects of the pandemic. Madagascar, like many other countries in Africa, faces particular pressure because of the appearance of new SARS-CoV-2 variants, which are more contagious and deadly. And and they're also associated to other diseases. Madagascar is currently facing a second wave of COVID-19. However, the epidemic curve has been decreasing over the past 4 weeks, with a significant drop in the positive case rate. Surveillance and case detection and rapid response measures were adopted, and contact net tracing was carried out right from the start. Biological diagnostics were strengthened. We've also been using various new types of tests for detection of COVID-19. Hospital care has been improved through the acquisition of technical equipment, including oxygen concentrators. Research has been carried out through various different initiatives to improve pharmaceuticals. Furthermore, we've also been establishing medicines agencies. We've also stepped up human resources, both in terms of quality and quantity. As a matter of priority, high-level coordination has also helped the involvement of all different stakeholders. Madagascar has been involved in the COVAX facility since 10th of May 2020, and we also are one of the priority target groups, and we've had the first delivery of 250,000 doses of the vaccine. We are committed to ensuring equitable access to vaccines. We would like to thank the WHO, as well as Gavi and other technical and financial partners, for their unflinching support for low-income countries to help to strengthen health systems through effective international coordination, as well as promoting compliance with IHR, which remains a major challenge in this pandemic. Many thanks.
Thank you, Madagascar. I now give the floor to Cuba, to be followed by the Democratic People's Republic of Korea.
Madam Chair, we would like to express our appreciation for the information provided by the Independent Panel on Pandemic Preparedness and Response. We also recognize the work carried out by the WHO as part of the World Health Emergencies Programme, and we also value the efforts carried out in the COVID-19 response, which unfortunately has not been brought under control. In terms of Cuba's efforts, we have benefited from the existence of a national health system based on primary health care, which allows active surveillance at all stages of an epidemic. It also helps to coordinate intersectoral, cross-disciplinary and preventive action. It helps to take swift decisions and promote individualized treatment for different patients, particularly those with comorbidities. Science and innovation have allowed us to establish a Cuban protocol to manage the disease. This includes various different actions related to mental health and protecting healthcare personnel that are caring for suspected and confirmed contact cases. The biotechnological industry has developed an array of products, preventive products, including 3 antivirals, 2 new anti-inflammatories, and 4 serological diagnostics. Furthermore, we have 5 candidate vaccines, 2 of which are in phase 3 clinical trials, which are currently being tested on high-risk individuals. This will help us make progress towards vaccinating 100% of the population, and we then plan to extend the use of this to other countries. The pandemic has shown the importance of the international health regulations, and we urge effective implementation of these regulations. The pandemic has laid bare an indisputable truth that health systems, social protection, education, and science and technology systems all need to be made available to everyone. It's necessary to constantly update these systems and exchange information on an ongoing basis to ensure that countries can adapt their strategies and be better prepared to control the pandemic and other future events. We support the draft resolution and would like to reaffirm that now more than ever, we need solidarity and cooperation. Thank you.
Thank you, Cuba. I now give the floor to the Democratic People's Republic of Korea, to be followed by Angola.
Thank you. Thank you, moderator, Madam Chair. First of all, on behalf of the delegation of the Democratic People's Republic of Korea, let me extend my solicitude to WHO and state parties to IHR for their joint efforts to fight against the COVID-19 pandemic. Madam Chair, the current pandemic teaches us that the strong leadership and coordination of the government, timely taken social measures are the most important and essential in responding to the pandemic. In this regard, the DPRK delegation would recommend WHO to update the IHR by adapting the experiences and lessons gained in the fight against the COVID-19 pandemic and the current reality so that it can provide correct and effective way to the state parties in response to the future pandemic. Madam Chair, since IHR came into force in 2007, the DPRK has made continued efforts to build and strengthen the national IHR core capacities as required. Concerning the current COVID-19 pandemic, DPRK has been fulfilling its obligations as a state party to IHR by regularly reporting WHO the epidemiological situation and social and public health measures taken by the government. Rapid response team are functional in all provinces and counties. They can be mobilized within 24 hours since the detection of an outbreak, and the preliminary report can be produced within 48 hours. Cooperation and collaboration between the public health and animal health sectors are comparatively good as well. The country has recorded some achievements in building and maintaining IHR core capacities, especially in respect of national legislations, policy, coordination, and human resource capacity. However, laboratory capacity needs to be strengthened at all levels in terms of quality assurance for diagnosis, biosafety, and biosecurity. DPRK will continue to intensify the human resources together with materialistic and technical basis, step by step, for further strengthening IHR core capacities. Thank you, Madam Chair.
Thank you to the Democratic People's Republic of Korea. I now give the floor to Angola, to be followed by Uruguay.
Thank you very much, Madam Chair. Angola endorses the joint statement made by Togo on behalf of the African states. The COVID response in Angola is based on an intersectoral prevention plan, which is flexible and is always adapted depending on emerging factors. This has helped to reduce the transmission of the virus, giving time to the systems to prepare for effective response. It's also based on epidemiological surveillance and the treatment of severe cases. In view of the emergence of new vaccinations against COVID-19, Angola has developed a national vaccination plan, which is designed to interrupt transmission of the virus. We have drawn up various different measures as part of our prevention plan. Angola believes that universal non-discriminatory vaccination plans are essential. It is crucial to leave no one behind. Furthermore, it's necessary for each country to have its own facilities and have access to these materials. Robust cooperation towards a shared objective is necessary to end the pandemic and build a healthier world. Angola supports the comments made in the report by the independent panel and the review committee, but we believe it's necessary to assess the effectiveness of the IHR as part of efforts to improve WHO's preparedness and response. And of course, later in 2021, we will be having a meeting to review the process and set up an intergovernmental process. Thank you very much.
Thank you, Angola. I now give the floor to Uruguay, to be followed by Afghanistan.
Buenos días.
Good morning. Many thanks, Chair. We have been very interested to examine the documents submitted by the WHO, which form a basis for our discussion on this very important agenda item at this assembly. First of all, we would like to acknowledge the excellent work that's been carried out by the WHO, which has faced extreme difficulties, and you can count on our support. The current situation with regard to the pandemic can be summed up in two main axes. First of all, it's necessary to support all of the efforts that have been deployed to combat the pandemic. And this is all the efforts have shown that we need an efficient, effective system to allow for early warning and alerts. And then secondly, it's important to control the rising numbers of cases and deaths, and we need to evaluate and address the economic impact as a matter of urgency. The work of international organizations tends to be geared towards promoting shared interests. At the moment, we have a very particular situation. What we are doing right now will not only serve the victims of this pandemic, it will do more than that. We need to show a sufficient commitment for the future. We understand that the only viable way to move forward is to strengthen cooperation and negotiate an instrument, whether it be a treaty or a convention, which sets out various different conditions and compliance requirements. It is important to take note that there could be quite requirements for states to give up part of their sovereignty to be able to comply with these requirements. The current situation shows that we need to continue relying on the WHO as a vital partner in these efforts. Only if we cooperate internationally in a comprehensive manner, we'll be able to move forward and succeed in the future. Thank you.
Thank you, Uruguay. I now give the floor to Afghanistan, to be followed by Hungary.
Well, thank you, Chair. Afghanistan would like to appreciate WHO efforts in regards to management and coordination of COVID-19 related issues globally. The Ministry of Public Health of Afghanistan, in collaboration with the health partners, including WHO, developed a comprehensive strategy to combat COVID-19. Implementation of this strategy enabled both the Ministry of Public Health and our partners to manage three waves of COVID-19 in Afghanistan. But still, COVID-19 is a global challenge, and low-income countries are more at risk. Afghanistan has started vaccination and is experiencing shortage of resources, particularly vaccines, to address this health challenge. Therefore, we hope that WHO state, non-state members consider equitable allocation of vaccines to ensure equity of services among higher and lower income countries. It will enable all countries to save the life of their nations, which is our giant responsibility. I thank you once again.
Thank you, Afghanistan. I now give the floor to Hungary, to be followed by Bhutan. Hungary, you now have the floor. Thank you, Hungary. We will come back to you. I now give the floor to Bhutan.
Thank you, Madam Chair. Bhutan would like to thank and commend the WHO for its leadership during the current COVID-19 pandemic. We would like to report that Bhutan, under the leadership of His Majesty the King, has taken unprecedented measures to prevent and contain the spread of pandemic. We have an extensive testing program with one of the highest testing rates and implement a robust contact tracing program. All people coming to the country must undergo a state-sponsored mandatory 21 days quarantine. However, we have also tried to ensure that essential healthcare services were not hampered and disrupted. We are deeply concerned with the emergence of new variants that are associated with increased transmissibility and greater pathogenicity. We also take this opportunity to thank WHO Sero, especially Regional Director Dr. Poonam Khetrapal, for the continuous support to Bhutan in our response against the COVID-19 pandemic. Madam Chair, we have also noted that the main report submitted by the co-chairs of the Independent Panel for Pandemic Preparedness and Response. We fully agree that we must continue to learn from this pandemic to contain it and to prevent future pandemic by the new pathogens. To do this, we reiterated the need for all members to work together. We would like to thank the Secretariat for reporting on the progress made in implementing the IHR. For the COVID-19 pandemic, we are aware of the need to continue the management of pandemic through temporary recommendations issued by the Director General as per the advice of IHR Emergency Committee for COVID-19. Therefore, we endorse the decision under this agenda item. Thank you, Madam Chair.
Thank you, Bhutan. I now give the floor to the Dominican Republic, to be followed by Hungary.
Since this is the first time our delegation is taking the floor, I should like to take advantage of this meeting to express our gratitude for the sacrifice made by healthcare workers and all frontline workers. They've been working so hard and making enormous sacrifices to help contain and end the COVID-19 pandemic worldwide. Dominican Republic notes the reports from the IPPR and the other committees and working groups which have been carrying out an evaluation of WHO's pandemic preparedness and response system. We also welcome their recommendations. We're in agreement with many of them, and we will analyze them with the necessary thoroughness. We would like to highlight one or 2 points. The question of the sustainable financing of WHO is one that we have to tackle if we are to be able to fight not only against this pandemic, but the next one. We need a WHO which is stronger than the one we have at the moment. The need to consider the advantages of a treaty or agreement on pandemic preparedness and response is also essential because we need an effective mechanism which will enable WHO and member states to assess risks and take the best possible decisions they can based on lessons learned and experience obtained. We support the resolution on strengthening preparedness and response and the establishment of a working group which will discuss and analyze the most salient aspects of this issue. We would also like to co-sponsor the decision to hold a special World Health Assembly in order to concentrate exclusively on this subject and take both rapid and effective decisions relating to it on the basis of transparency, consensus, and inclusion of all parties concerned. Vaccination, of course, is a matter of massive global public health importance, and we urge the international community to consider the possibility of waiving patents on COVID-19 vaccinations. We attach great importance to the issue of mental health as well, and including it in pandemic preparedness and response. We therefore endorse the initiatives which are being taken on this issue, and we hope they will be implemented. We consider mental health afflictions a silent pandemic to which we should pay equal attention as that which we pay to the pandemic as such. We have been working hard to contain the pandemic in our country. Many economic and social sacrifices have been made with that end in mind, and we would like to take this opportunity to express our solidarity with other countries in their efforts to bring the pandemic to an end. Thank you.
Thank you to the Dominican Republic. I now give the floor to Vanuatu. Vanuatu, you have the floor.
Thank you, Madam. Thank you, Madam Moderator, Director General Tedros, Ministers, Excellencies, and distinguished delegates. Before I begin my statement, I would like to say on behalf of Vanuatu that we pass on our condolences to those who have lost loved ones during the current pandemic. Madam Moderator, we thank the review reports, including the experts and all involved. COVID-19 shows that we have shortcomings and that despite or because of it, the current efforts indicate a glaring imbalance in how pandemics are addressed. We acknowledge the report presented to us yesterday and welcome the inclusiveness and other positive elements and the challenges that set out. We welcome the findings and recommendations of the independent panel, and the level of ambition it presents is much welcomed. We know it talks about bringing the pandemic to an end, but we must deliver and give a clear and realistic pathway for a comprehensive response by WHO on pandemics. Look forward to how we can implement the measures that will be finalized in the coming months. We must address access equality, and we hope that a transparent and predictable funding elements can be put in place to address pandemics today and in the future. We are encouraged that there are new vaccines in the development pipeline that will be suited to the Vanuatu situation, and we encourage technical transfer to reduce barriers to manufacture so that this can be produced at more sites to meet global demand. Vanuatu thanks our partners for supporting us, Australia, New Zealand, China, and others for the vaccines and other measures. Madam Coordinator, a new pandemic treaty will be a testament to the intent of members for cohesiveness of countries and will unite us as humanity to address the challenges that face us. The report gives us options for preparedness and response, which clearly shows that we need to strengthen our systems, all part of our effort to ensure global health security. We are responsible and accountable for the future, for the current infrastructure, for future infrastructure, and the resources that we must provide to address pandemics. With reference to the international health regulations, the review committee will now have a set of proposals before us and hope that all member states will take them in full account. And we thank them for the high quality of the proposals and hope that state parties will support them. We look forward to further consultations. Finally, Madam Cornetta, we inform all that Vanuatu supports ANISA co-sponsored proposal for the special World Health Assembly this year. And all the proposals of treaty and international health regulations covering health emergencies, preparedness and response. I thank you, Madam Chair.
Thank you, Vanuatu. Madam Chair, there are no further requests from member states for the floor. I give the floor back to you.
Thank you very much. I now give the floor to the Secretariat to respond. I first give the floor to the Regional Director for the Western Pacific, Dr. Takeshi Kasai. Dr. Kasai, you have the floor.
The Western Pacific region was hit hard by the SARS outbreak of 2003. Since then, we have embarked on a long journey of investing in pandemic preparedness together with the WHO's Southeast Asia vision. Through our bi-regional Asia-Pacific strategy for emerging diseases and public health emergency, or known as UPSED, now in its third iteration, we have supported member states to develop the capacities required under the international health regulations. UPSED employs a long-term and step-by-step approach to strengthening health systems. It can be flexibly tailored to countries' context and promotes an environment of learning and improving and partnership. To stay focused on our long-term goals, our member states gather once a year to share and discuss their progress with other countries, technical advisors, and partners. And the regional office and country office work as one to help countries implement recommendations to fit their context. In July 2020, we organized this annual meeting to take stock of our response to COVID-19. And we were very happy to hear the member states and experts' views that the past recommendations of the meeting and investment in this area has been fully utilized by member states in their national response efforts. But we also noted challenges that had not been previously considered. There were several instances in the early days of COVID-19 with international conveyances. We noted that addressing this required the international community to come together to find solutions, take the right actions, and reach agreement. Now, we have received reports from the panels on the evaluations. I appreciate all member states' comments on these reports, and I would like to carefully review all of them. UPSED employs a two-tier approach, by which we mean that while we are responding to the situation in front of us, we also prepare for the next outbreak. We will incorporate some of the recommendations from the evaluation so that we can prepare for the next outbreak through responding to COVID-19. Implementing other recommendations might require long-term planning. Maximizing global solutions require synchronizing effort at the national and subnational level. I would like to commit myself to working with headquarter colleagues and others on how we move forward from here on.
The COVID-19
Thank you very much, Dr. Kasai. I now give the floor to the Regional Director for the Americas, Dr. Caris Etienne. Dr. Etienne, you have the floor.
Muted. Thank you, Madam Chairperson, Excellencies, distinguished representatives, colleagues. The Americas has been the epicenter of the pandemic for more than a year, and all member states have been working tirelessly to respond to the challenges and to roll out COVID-19 vaccinations. Nevertheless, as of yesterday evening, more than 65 million cases and 1.6 million deaths have been reported in our region. Although there is a general decline in the number of new cases and deaths in the Americas, some countries are struggling to cope with the influx of patients. Occupancy rates of ICU beds remain a challenge for most of our countries, and all 4 variants of concern have been sequenced in the region with increasing frequency. Our healthcare workers have been greatly affected. 1.8 million, or 12% of the total health workforce, have been infected, with at least 9,000 deaths. We salute all healthcare workers for their heroism. Equitable access to vaccines is a priority, but still far from becoming a reality. Vaccines are in limited quantities, and many countries of Latin America and the Caribbean, with higher levels of COVID-19 transmission and deaths, have had minimal availability of vaccines. There are many indicators that in the next months, there will be recurring waves and outbreaks occurring in different locations and times within the same countries, subregions, and regions. AMRO-PAHO has worked with member states in conjunction and aligned with the WHO Strategic Response Plan. We note that most of the critical issues emerging from the COVID-19 pandemic experience have not yet been fully analyzed and understood. Important issues remain regarding leadership, stewardship and governance, epidemic intelligence, health systems and services, delivery networks, and emergency operations, response, and supply chains. Going forward, the governance of health emergencies needs to be crystal clear about the intent, processes, and procedures. It is paramount to strengthen the role of the WHO governing bodies and the Secretariat itself. A renewed commitment for global preparedness and response architecture is urgently needed. The world will benefit from greater transparency and accountability in the entire evaluation and recommendation processes. Undoubtedly, the most important experience come from the countries themselves, who are at the forefront of the response and are dealing with multiple technical, social, political, and economic challenges. Therefore, it is really a unique opportunity to listen to our member states here. Every day gives us the opportunity to work together with the fullest cooperation of individuals, all of society, and all of governments, sharing our responsibilities and enabling collective efforts to limit the impact of this brutal pandemic. Thank you, Madam Chair.
Thank you very much, Dr. Etienne. I now give the floor to Dr. Michael Ryan. Dr. Ryan, you have the floor.
Thank you, Chair, and thank you to our member states for hugely wide-ranging responses on the work of the various panels. I believe there was a huge deal of consistency across the comments of the member states, and a number of very clear common themes, I think, emerged from all of your interventions. There was a clear focus on ensuring that the international health regulations be central to all we do in terms of better compliance, periodic review, a strong focus from member states on ensuring that strengthening core capacities at national level remains at the core philosophy and principle of global health security. Specific reference was made to building resilient health systems by multiple member states, to expanding and developing further lab capacity, including sequencing capacities, for expanding national research and national ownership of research, and for especially within that, focusing that support on member states with large vulnerable populations or in very vulnerable situations, like low-lying island states, populations with high proportions of migrants, fragile, conflict-affected and vulnerable countries. We thank the member states for their many references to supporting and strengthening of WHO, including its mandate, its staffing, its sustainable financing, and its capacities and technical operational capacities, both to quickly assess and investigate events through to our ability to deliver norms, standards, and deliver on our operational commitments to our member states. Again, member states referred to multilateral cooperation being central, and many member states referred specifically to the concept of treaty, which I believe will be discussed also in the next session. And again, we welcome those comments and the political momentum and the sense that member states really want to focus on ending the acute phase of the pandemic, but clearly want to move on longer term frameworks that will allow us to prevent the next one. And these are things we can do at the same time. Many references then specifically to taking a One Health approach, and specific references to vaccine certificates, infodemics, gender and emergencies, wet markets, laboratory infrastructure, the Global Outbreak Alert and Response Network, and we will engage directly with member states who had specific questions on issues related to those issues. I do hope, and many of you have said this very clearly, that we can move beyond the rhetoric to co-creating a new reality with our communities, a safer world, a fairer world, sustainable world, a world more in balance, that integrates the concepts of animal, human, and planetary health, a world that's on the alert and ready to respond together, truly on the alert, truly ready, and truly together. Not a road paved by broken promises and endless recommendations, but underpinned by a generational commitment to practical action for health and health security. And as Director General Dr. Tedros says, a world committed to science, to solidarity, and to solutions. And with that, Chair, I pass the floor back to you.
Thank you so much, Dr. Ryan. I understand that the co-chair of the independent panel for pandemic preparedness and response, as well as the chair of the Independent Oversight and Advisory Committee for the World Health Organization Health Emergency Programs, and the Review Committee on the Functioning of the International Health Regulators 2005 during COVID-19 response are available online and would like to make interventions. I would therefore like to give the floor to Her Excellency Ellen Johnson Sirleaf.
Thank you, member states and distinguished guests. Prime Minister Clark and I would like to thank you all for your interventions and appreciation of the panel's work. The panel has offered a concrete agenda for action and reforms, both for you here at the World Assembly and beyond. We have heard many of you say that business as usual is not an option if we are to prevent another pandemic, and that confirms our view that transformative change is needed urgently. Moving ahead, what is needed now is action on the recommendations for reforms. Member states, you have now the opportunity to make important decisions. We are in the middle of a preventable global crisis, and we must all use this moment to take the necessary political decisions. We must make the international health and emergency system more coherent in order to secure a much more effective pandemic response across all health, social, and economic domains in the future. We need leadership of heads of states and government, and we also need the strengths of civil society and the private sector. We are glad that member states have recognized the potential for a pandemic treaty and a special session of the World Health Assembly in November. That is 6 months from now. We urge you to use those 6 months ahead also to act on decisions that the panel has laid out in regard to reforms for a stronger and more independent WHO. A special session of the Assembly could also be an opportunity to make progress, not only on the treaty, but other recommendations critical to ensure that this is the last pandemic. Many of you have noted that we are also recommending a special session of the United Nations General Assembly in New York. The purpose of this is to complement the important work taking place here with you at the Assembly to secure political agreement for a roadmap for a strengthened international system at large, including the establishment of a global health treats council to support multi-sectoral coordination and a secure financing mechanism for the future. Our aim is to do whatever it takes to make this the last pandemic. Member states, regarding vaccines, we simply need to see more doses shared and faster. The panel gave the world a target of 1 billion doses to be redistributed before 1st September. We have seen some progress, but much more is needed. And we know that the doses are available. There's no time to wait. The panel has delivered its report. There is now time for implementation. We as co-chairs and panelists will be monitoring the implementation of the recommendations, and we are available, if required, to help with the important work ahead. Prime Minister Clark and I are deeply grateful to have been given this opportunity to lead the work of the independent panel. We appreciate all the support and contributions from around the world that made this work possible. I close with that which we continue to say: let's make this the last pandemic. Once again, Madam Chair, we thank you and the members so much for the opportunity.
Thank you very, very much, Her Excellency. Next, I would like to give the floor to Dr. Felicity Harvey. Dr. Harvey, you have the floor.
Thank you, Madam Chair. Honourable Ministers, Excellencies, Heads of Delegations, Director General, and distinguished colleagues. On behalf of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Programme, I'd like to thank Member States and Dr. Tedros for their confidence in IOC's work and for all of Member States' interventions. IOC also wishes to thank the Independent Panel for Pandemic Preparedness and Response and the International Health Regulations Review Committee for their collaboration and open discussions through our evaluation process to review the WHO response to COVID-19. As noted by Germany and USA, every major health crisis has generated innovative ideas and recommendations from many studies, reviews, and reports into what went wrong and the analyses of how the world could do better in the future. We have noted the recommendations made back in 2015-16 following the West Africa Ebola crisis had some similarities. We've also observed that recommendations we've been discussing call for fundamental changes requiring collective action by WHO, member states, who are each accountable for global health and are able to implement the recommendations collectively. I wish to quote the comment that South Africa made on behalf of the Friends of the Pandemic Treaty. Business as usual is not an option. It is time to take bold decisions and immediately act upon them, strengthening WHO and building an overarching architecture for global health based on solidarity and equity. Therefore, I commend member states for establishing a working group on strengthening WHO preparedness and response to health emergencies to ensure implementation of the recommendations, and we look forward to supporting the working group. This is a defining moment for global health, and IOC reaffirms its commitment to providing oversight and advice to WHO Secretariat. But member states and partners must play their part as well to help the organisation fulfil its role in protecting the health of populations across the world. As President Sirleaf said, let's make this the last pandemic. Thank you very much. Thank you.
Thank you very much, Dr. Harvey. I would now like to give the floor to Professor Lothar Wheeler. Professor Wheeler, you have the floor. Okay. Well, meanwhile, we try to get contact with Professor Wheeler. I would like to remind you that today at 13:10, we have primary healthcare, universal healthcare coverage from commitment to country implementation. And details on how to connect can be found on the daily journal. Now, I will now give the floor to the Director General, Dr. Tedros.
Yeah, thank you, Chair. I think our Regional Director for Afro, Dr. Shiri Moeti is online to take the floor, so I will speak after her. Is she not around? Okay. And Professor Wheeler, still the same? Okay. So mine is very, very short because my colleagues have already said, Mike and also the panel co-chairs. So I am taking the floor to thank all member states for your inputs and guidance, and look forward to the implementation of these excellent recommendations. As I said yesterday, there are very bold recommendations, many bold recommendations. And as what President Sirleaf said, what's now next is to implement these bold decisions. Of course, I know there will be intergovernmental groups and other working groups that will take this forward. And I would really suggest that we install all the mechanisms that we need in order to focus on the implementation. And also my appreciation to all chairs, starting from President Sirleaf, Prime Minister Clark, Dr. Harvey, and Professor Wheeler. I know how you have been working under constant pressure for the last months, and I'm really grateful for your dedication and commitment, and at the same time for the timely submission of good quality reports. So thank you so much indeed. And we look forward to continue to work with you to consult. You can continue to give us your support, and I assure you that we will keep in touch to get the support from you. So with that, thank you so much, and much gratitude from WHO. Back to you, Chair.
Thank you very much, Dr. Tedros. Well, that concludes our discussion on this grouping. We will now return to our discussion on the technical updates on the COVID-19 response. You will recall that we suspended this item yesterday before we had completed the statement from member states. Those member states who still wish to address this should raise their hands again now. I would now like to give the floor to the moderator to manage the list of speakers. Thank you very much.
Thank you, Madam Chair. I now give the floor to Canada, to be followed by Argentina.
Chair, we would like to express our continued appreciation to Dr. Tedros, Dr. Ryan, and all WHO staff. Thanks to you, WHO's leadership, coordination, and technical guidance is making an enormous contribution to the fight against COVID-19. Many of these contributions will never make media headlines, but are crucial nonetheless. We also express our thanks to Dr. Etienne and people for their regional leadership in responding to COVID-19. This pandemic has reinforced the critical role of WHO regional and country offices and the power of leveraging the entire UN system and other global health actors around common objectives. These trends should continue to be reinforced beyond COVID-19. COVID-19 has exacerbated inequalities, including for women and girls. Those most at risk from COVID-19 are often the same population disproportionately impacted by public health measures. We call on the WHO to further strengthen its capacity to integrate a gender, equity, and rights approach into its emergency response. A priority for Canada continues to be promoting evidence-based and gender-responsive guidance and decision-making in support of the global response to COVID-19. We must also ensure that the global response remains sufficiently resourced to support those most affected and disadvantaged. To this end, Canada has made significant contributions to the global COVID-19 response, including $1.3 billion to the ACT Accelerator to foster equitable access to COVID-19 tests, treatments, and vaccines. All countries need access to these COVID-19 tools. The ACT-A funding shortfall for 2021 is $18.5 billion. We must all do our fair share to support this global effort because we know that the success of ACT-A is the world's best exit strategy from this pandemic. Research and the application of research is critical to these efforts. This month, the Canadian Institute of Health Research will launch a new framework for action on global health research, which recognizes that global health threats require the collective mobilization of knowledge and action of the entire international community. Canada will continue to collaborate with international partners, including the WHO, to harness the power of research towards better health for all. Finally, we would like to highlight the importance of strengthened international scientific collaboration and transparent, rapid information sharing in support of a One Health approach. This includes future work to continue to study the origins of these pathogens so that we can learn for the future and take the necessary steps to remove risks and ensure that this never happens again. The joint WHO-China mission was an important first step, and additional data-driven studies are needed, inclusive of broad expertise. In closing, we must continue to be vigilant in our response to COVID-19, monitor variants of concern, and implement public health measures. With these actions, I hope that when we gather again next year, it will be in person in Geneva. Thank you very much.
Thank you, Ken. I now give the floor to Argentina, to be followed by Cambodia.
Thank you very much, Madam Chair. Argentina takes note of the report and thanks the Secretariat of the WHO for the efforts they've made to respond to COVID-19 and for support received from United Nations and other international organizations, civil society, academia, and non-state actors. Argentina has implemented its COVID-19 response, prioritizing protecting people's lives. In that regard, our country has stepped up epidemiological surveillance and decentralized diagnostics, setting up over 130 laboratories for respiratory virus analysis, which can process samples. With regard to digital health, various different programs have been launched, including tele-ITU, remote ICU, that provide assistance to medical teams. Furthermore, a specific mental health platform was created with a view to providing tools to health workers at the first and second level of healthcare. In terms of production, the capacity to produce mechanical ventilators was doubled, and we converted a section of the textile industry to produce personal protective equipment, as well as producing active ingredients for one of the COVID-19 vaccines. In terms of research and development, various different initiatives were carried out, including the use of saliva as a sample instead of swabs, serological tests, and convalescent plasma therapy. Furthermore, Argentina participated in the Solidarity 1 clinical trial and clinical trials for various other vaccines. Madam Chair, guaranteeing equitable access to medicines and vaccines is a precondition for promoting the right of all individuals to enjoy the highest attainable level of physical and mental health. This must be a priority for all states. Nevertheless, serious inequalities in access to medicines and vaccines is unjust and runs counter to the interests of the international community as a whole. Therefore, we're convinced that the WHO and WTO have a key role to play in removing bottlenecks in supply chains and scaling up production, particularly of vaccines. Our country has joined the COVAX mechanism, showing its firm commitment to fair, equitable distribution of COVID-19 vaccines. Nevertheless, we'd like to highlight that there are certain challenges, such as agreeing on terms for liability and compensation, despite the guidelines issued by the WHO. There's also been a lack of predictability in the allocation rounds and difficulties in delivery, despite all of the efforts made by various countries, including the low and medium income countries, to meet the advance payment requirements and the necessary guarantees. Lastly, we'd like to highlight the key role of local production of medicines and treatments and vaccines, as well as other health technology. Technology transfer is also extremely important, as well as the temporary waiver of intellectual property rights, and in addition to flexibilities that need to be built into various agreements, including the TRIPS. Thank you very much.
Thank you, Argentina. I now give the floor to Cambodia. Following Cambodia, we will return to the intervention from the Regional Director of AFRO, Dr. Moati. I give the floor to you, Cambodia.
Thank you, Madam Chair, distinguished guests, ladies and gentlemen. First, I would like to express my deep appreciation to the invitation extended by Excellency Dr. Tedros, Director General of the World Health Organization, and thanks to the chair giving me the floor to speak. COVID-19 pandemic throughout 2020 in Cambodia was less than 500 cases and no deaths. Key factors that contributed to the success were whole of the government and whole of society approach, solidarity and cooperation between Cambodia and partners, and past investment in health security that ensure effective surveillance and rapid response to COVID-19. Additionally, Ministry of Health and senior government officials ensure consistent effective, and precise risk communication to the public to guide them in taking precautionary measures against COVID-19. Past investment in health security based in the Asia-Pacific Strategy for Emerging Diseases framework for building core capacities aligned with IHR 2005 have enabled a functional public health response system in Cambodia. These included deploying operational rapid response team for investigation, specimen collection, and contact tracing, effective 24/7, event-based surveillance, and availability of rapid high-quality RT-PCR laboratory testing. Cambodia developed a national master plan for the COVID-19 response and provincial level plans in all 25 provinces, which are being rolled out with a focus on community engagement in preparation for a potential scenario of large-scale, widespread transmission. The aim is to use the opportunity presented by the pandemic to build a responsive, functional health security system down to community and village level that is relevant to the needs and readiness priorities for individual provinces. Cambodia has used pandemic preparedness to strengthen the health security system during the pandemic to make it fit for the future, including expansion of sample collection and public health laboratories, healthcare system surge, including home care in terms of both personnel as well as equipment and supplies, enhancement of systematic surveillance and response functions, especially case investigation and contact tracing, better risk communication and greater community engagement for ensuring the new normal, supporting specific settings such as garment factories, schools, markets, and entertainment venues to put in place best practices and ensuring cross-pillar and cross-sectoral coordination. Finally, I wish Your Excellency, ladies and gentlemen, good health and success in your deliberation. Thank you very much, Madam Chair.
Thank you, Cambodia. I understand that the Regional Director for Africa, Dr. Moeti, is now on the line and wishes to make comments on the previous grouping. Dr. Moeti, you have the floor.
Thank you very much, Madam Chairperson, honorable ministers and delegates. African member states took early, determined, and strong action in response to the COVID-19 pandemic. But we know that this came at great economic cost, which will continue into the future. The pandemic has indeed presented enormous challenges to our member states in the African region as it has to the whole world. Our countries have also been dealing with outbreaks of Ebola, measles, and yellow fever, among others, and humanitarian crises. They have pushed to sustain hard-won health gains and to minimize the pandemic's impact on actions to prevent and treat other diseases. COVID-19 has brought the importance of equity into focus to protect the most vulnerable. Even in high-income countries, equity has determined who was worst affected in terms of infection, mortality, and social and economic repercussions. The value of investing in preparedness has also been reaffirmed. It is in the interest of all countries that this pandemic is contained everywhere and as soon as possible. We deeply appreciate the action of countries that have started sharing vaccines, and I'd like to echo the Director General's remarks in his opening address that much needs to be done immediately and in significant quantities to make a difference. The ACT Accelerator, including the COVAX facility, and the African Union's platforms with which we are collaborating closely, have pioneered multilateral solutions to enormous global supply distortions. We need to do much better, clearly, to support low-income countries. African countries are determined, looking ahead, to produce their own essential commodities, including vaccines, thus building resilience and self-reliance. We commend and will act to support this. The upcoming piloting of universal health and preparedness reviews will further assist in charting the way forward in countries. All of the member states in the African region have undergone external evaluations of their international health regulations capacities in the past 3 years and are therefore well positioned to participate in this new process. Countries have developed roadmaps to cover the gaps identified in the evaluations. And I'd like to urge partners to support the financing of these plans to advance the dual goals of strengthening health systems and scaling up preparedness in the African region. In closing, my colleagues and I are looking forward to the decisions following the recommendations made by the independent panel and the review and oversight committees. We remain committed to working with partners to support our member states in implementing the changes that will make health systems more resilient and enhance capacities for preparedness and dealing with outbreaks in the region. I thank you very much for your attention.
Thank you, Dr. Mwati. I now give the floor to the Philippines, to be followed by Hungary.
Thank you, Madam Chair. The Philippines joined the list of co-sponsors of the resolution penned by the EU as a follow-up to the WHA 73.1 resolution on COVID-19 response and the group of friends led decision on a WHA special session to consider an instrument on pandemic preparedness and response. The Philippines, cognizant of the multifaceted public health, economic and social issues brought about by the COVID-19 pandemic, is one with the WHO and the global health community in its efforts by strengthening emergency preparedness and response to public health emergencies. We affirm the important role of the WHO in leading the charge towards more prepared, secure, and resilient health systems as espoused by the international health regulations. Thus, we support all initiatives that are geared towards the strengthening of the WHO Health Emergencies Program so it becomes more responsive to the dynamic and complex needs of our times. In particular, early alert and notification should lead to early action, and early response should facilitate advanced coordination and promote trust. These are important both at the international and national levels. Our own experience brought to the fore the importance of compliance to the IHR. If only all member states have built stronger core capacities for preparedness, surveillance, and response, we know we would all be delivering better and global response would have been more effective. So through this crisis, we see a great opportunity being presented to us. In the Philippines, we are advancing the passage of important laws to strengthen the country's disease control and prevention infrastructure. Through an empowered national focal point, we are endeavoring to elevate health security to the highest governance level, require actions from multiple sectors, and craft a national action plan to mount a robust and coherent response to any public health emergency. We are resolute in implementing our universal healthcare law, which seeks to strengthen our national health system. We are committed to strengthening our surveillance, health promotion, emergency preparedness and response systems through sustained financial investments, focused capacity building, and effective risk communication and community engagement. The Philippines would like to extend its gratefulness to the WHO for its technical leadership and support during these challenging times. Now, more than ever, we have to build better preparedness and response to public health emergencies. We can try to rewrite global health history now if we are able to do this. We are very confident we can if we, all member states, all health security stakeholders, the WHO, as we continue working together as one community. Thank you, Madam Chair.
Thank you to the Philippines. I now give the floor to Hungary, to be followed by Vanuatu. I understand that Hungary has a video.
Dear Director General, Chair, Honorable Ministers, distinguished delegates, Hungary has been paying close attention to the international health regulation and has maintained its epidemiological surveillance system in a strict manner even before the COVID-19 pandemic. For us, a quick response system is of essence, and in the beginning of 2020, we were able to react quickly and swiftly for the upcoming threat. On the 24th of January, when the first European COVID case has been reported, and same day, Hungary started the necessary preparation. During the first wave, the early response enabled us to closely eliminate the virus very soon, so we got a very, very flat curve for that. During the second and the third wave, we have been highlighting the importance of continuous testing and been following a social response for the introduced restrictive measures. The citizens were supporting the government's decision and followed the set of rules and advices, which resulted in the healthcare system ability to withstand the pressure caused by the increasing number of hospitalizations. At the same time, Hungary started preparation for an ambitious vaccination program. Vaccination started on the 26th of December 2020 after the arrival of the first lots. First, healthcare workers, caregivers, and residents in social institutions were vaccinated. Vaccination of high-risk chronic patients in general population is currently underway. The vaccination campaign for pregnant women has started, and before the reopening of elementary schools, teachers and later teenagers have also been involved. An online booking website has been dedicated for the citizens to register for their shots, regardless of age or health status. At the moment, intense work is being done at daily level to vaccinate as many people as possible, and the results of these efforts can already be measured in lives saved. Our vaccination procurement has been reaching wide. Beside the European joint procurement, we have vaccine stocks from our Eastern partners. The vaccination campaign is currently underway with 6 types of vaccines, as in addition to the EU vaccine purchases, the Russian-developed Sputnik V and the Chinese Sinopharm vaccines are also available. Due to this success, Hungary is now slowly reopening, allowing everyone to enjoy open-air terraces, while those vaccinated can also visit cinemas, theaters, restaurants, cafes, and so on. We could reopen schools and kindergartens, and the curfew has been delayed till midnight, and the healthcare system is under much less pressure, and people in general can cautiously return to their everyday normal lives. We are ready to work on international and multilateral level to end this pandemic and prevent the next one. We do recognize the important work and proposals of the evaluation panel in this process. Thank you very much for your kind attention.
Thank you, Hungary. I now give the floor to Vanuatu, to be followed by Saudi Arabia.
Thank you, Madam Chair, Director General Dr. Tedros, Excellencies, and distinguished delegates. We thank the review reports, including experts and all parts involved in. COVID-19 shows that we have shortcomings and that despite or because of them, the current efforts indicate a glaring imbalance in how pandemics are addressed. We acknowledge the reports presented to us today. We welcome the inclusiveness and other positive elements and the challenges that are set out. We welcome the findings and recommendation of independent panel and the level of the ambition. Bring the pandemic to an end. We must deliver and give clear and realistic pathway for a comprehensive response by WHO on pandemics. I look forward to how we can implement the measures that would be finalized in the coming months. We must address access equality, and we hope that the transparent and predictable funding elements can be put in place to address pandemics today and future. We're encouraged that we have new vaccines in the development pipeline, and we will be suited to Vanuatu, and we encourage technical transfer to reduce barriers to manufacture and to meet the global demand. Vanuatu thanks our partners who are supporting us, Australia, New Zealand, China, and others, for delivering vaccines and other supplies. Madam Chair, a new pandemic treaty will be a testament to intent of members for cohesiveness of countries and elements of humanity to unite. The report gives us an option for preparedness and response, which clearly shows that we need to strengthen our systems, all part of our efforts to ensure global health security. We are responsible and accountable for the future of our infrastructure and reserves. We now have a set of proposals before us, and we hope that all member states will take them in full account, and we thank them for the high quality of proposals and hope that state parties will support them. We look forward to further consultation. Thank you.
Thank you, Vanuatu. We will now go to Saudi Arabia, to be followed by the Regional Director for Southeast Asia.
Thank you very much, Chair. First of all, I would like to thank the World Health Organization for the role it's been playing. I would like to thank the WHO for the efforts it's made to promote global cooperation, particularly in the context of COVID-19. I'm happy to be involved in the efforts towards combating COVID-19 in Saudi Arabia. We have managed to take preventive measures and play a leading role in these efforts. Furthermore, at the international and national level, we've engaged in scientific efforts to provide treatment and develop effective remedies to stem the pandemic. The leaders in Saudi Arabia have also been working based on experience learned from MERS outbreaks previously. And we took significant preventive measures before the first case was identified in the kingdom. Determined preventive measures were taken to step up capacity and stem the spread, as well as effective case detection and preparedness. We adopted a number of decisions to carry out these efforts, including field testing and stepping up laboratory capacity for COVID-19. Furthermore, we carried out regional efforts throughout the country. We also provided unhindered access to treatments and testing on a non-discriminatory basis. We also carried out coordinated action as part of our epidemiological systems to respond to the COVID-19 pandemic. We would like to call for immediate action to implement the recommendations contained in the report, which calls for the adoption of an international treaty and also mentions item 19 of the WHO Constitution. All of these principles must be underlined. It's also important to issue a political declaration by governments and countries for approval by the United Nations General Assembly at a special session. It is also necessary to commit to all the measures that have been adopted to combat future pandemics. Thank you.
Thank you, Saudi Arabia. On behalf of the Chair, I now give the floor to the Regional Director for Southeast Asia, Dr. Poonam Singh. Dr. Singh, you have the floor.
And natural hazards. Several countries of the region are currently experiencing high transmission, with more than 2 million cases being reported on a weekly basis, resulting in overstretched healthcare systems. Lives and livelihoods are at stake across the region as new variants emerge. As mentioned by the Director General, the world is at risk. The WHO Southeast Asia region continues to respond to the COVID-19 pandemic with speed, scale, and solidarity. Throughout the COVID-19 response, WHO has provided member states technical, operational, and logistic support. Most countries have now started vaccination with more than 216 million doses of vaccines which had been administered in the region, with around 53 million people fully vaccinated. However, the region faces ongoing challenges of vaccine availability and supply, as mentioned by Indonesia and Maldives. WHO continues to strengthen the capacity of health workers to detect, manage, and treat mental health conditions, and continues to advocate for increased access to mental health resources for health workers themselves in this very challenging time. Member states have made bold political commitment and shown a strong will in strengthening health systems since 2014, when emergency risk management was identified as a regional priority. However, the experience of COVID-19 has highlighted many challenges, including human resources, supply chain issues, and financing. As several member states, including India, Indonesia, and Maldives, have pointed out that no nation alone can combat COVID-19 crisis. In that spirit, WHO continues to vigorously engage with partners in the region and beyond, though there is a recognition of an urgent need for further strengthening global collaboration and solidarity to enhance equity and inclusiveness. The region welcomes the recommendations of the IPPR, IHR Review Committee, and IOAC. Member states have already expanded the scope of the CR Health Emergency Fund to include the preparedness stream through an RC resolution. Strengthening WHE capacity in country offices and allocating most available funding to member states. And I may mention here that 91% of COVID funding received by the regional office in the current biennium has been allocated to member states of the region. Strengthening WHO at all levels, including through adequate and flexible funding, as highlighted by Bangladesh, Bhutan, and several other member states, is critical for the region to serve our mission to promote health, keep the world safe, and serve the vulnerable. Thank you.
Thank you to the Regional Director, Dr. Singh. I now give the floor to our Chair. Madam Chair, over to you.
Thank you very much. I understand now that Professor Wheeler is now here available online. So Professor Wheeler, you have the floor.
Honorable Chair, Director General, Your Excellencies, ladies and gentlemen, colleagues.
I'd like to echo what has been said by my esteemed colleagues, the co-chairs of the IPPPR and the chair of the IOAC, in what has said. This is a moment that you have to take. I think it's a moment that can be considered as a huge chance to make the world a better place and a more safe place to be prepared for the next pandemic. I just want to highlight again that the IHR is the legal instrument of the member states. Please make this legal instrument a successful one. Please bring IHR into living. And I'd particularly like to express my gratitude to the interventions of the member states during this 8-month journey. They were very fruitful, helpful, and we very much appreciate these. Let me finish by saying that this has been an honor and a privilege for all of my esteemed colleagues of the Commission to serve all the WHO member states. And the last comment that I'd like to make to wrap it all up. If we fail to prepare, we prepare to fail. Thanks indeed. Take care, stay healthy, and make this world a safer place in the future.
Thank you very much, Professor Wheeler. Thank you to everyone. We have come to the end of our meeting this morning, so we will suspend this discussion and return to it this afternoon. To recap before we close, we are currently discussing the grouping of agenda items under 17 and 18, especially the technical update and up-to-date on the COVID-19 response. Before we close, I will ask the moderator to read out the list of member states with their hands raised. Please note that you will need to raise your hand again when we reconvene this afternoon.
Thank you, Madam Chair. The member states with their hands currently raised are South Africa, Colombia, Egypt, Norway, Sri Lanka, and Burkina Faso. I turn the floor back to you, Madam Chair.
Thank you very much. This meeting is now closed. Members of state who wish to take the floor, I will invite you to please raise your hand again to indicate that you still wish to take the floor. To make it very clear, we are addressing the bullet point under agendas items 17 and 18, entitled Technical Update and Update on the COVID-19 Response. I will now give the floor to the moderator to manage the list of speakers.
Thank you, Madam Chair. I now give the floor to Egypt, to be followed by South Africa.
Yes. أنا مندوبة مصر. بداية أعبر للحضور الكرام عن شعوري بعظيم الشرف لقدرتي على التواصل معكم من خلال هذا الحدث الهام. وأنتهز الفرصة لأبين لكم عميق تقديري لجهودكم الكبيرة والمؤثرة في مجال الصحة العامة.
All the efforts that are laudable that have had an impact on public health. And I would like to speak about certain important items. The efforts that have been undertaken by the Minister for Health in Egypt through the General Department for Mental Health and the Treatment of Addictions has received continuous support from the WHO, and this from the very first wave of the pandemic that hit our country. Now, these efforts have been very effective. We have cooperated on several different projects to improve services, to improve technological access, as well as scientific research. In what regards the mechanism for the international coordination, as well as the implementation of a global platform for NCDs, we think that it is absolutely necessary for this mechanism to exist and to continue existing. This will help us with achieving our objectives. Now, regarding the protection of people in health emergencies, we would like to speak to you about what we have found out in the past year. Indeed, we have faced several important challenges in our country during this pandemic, and this has really shed light on the need to support mental health activities. It is necessary to help all categories of the population when it comes to mental health, especially people that are ill, that are in specialized hospitals, healthcare workers, people that suffer from addictions, and all of those who take care of children. We also want to really underscore the fact that we need to help people that are suffering from mental health disorders. In specialized hospitals, they face different levels of stigmatization. There's a stigmatization linked to their mental health disorder, and secondly, stigmatization linked to having COVID. We would like to implement a special strategy that has to do with people that are suffering from mental health disorders. We want to protect and promote their rights, especially the rights that have to do with access to diagnostics and healthcare services that they require. Thank you very much, Madam Chair.
Thank you so much, Egypt. I now give the floor to South Africa, to be followed by Sudan.
Thank you, Madam Chair. South Africa would like to thank the Secretariat, the review committees, and panels for the report presented, and associate ourselves to the regional statement presented by the Honorable Minister of Cote d'Ivoire on behalf of the 47 countries in the African region, as well as other proponents of the decision on the pandemic treaty together with their partners. South Africa bears the highest number of cumulative COVID-19 cases within the African region and continues to have the highest number of COVID-19 cases in the SADC region, accounting for 76% of all the cases and 85% of all deaths. As we stage our national response in line with the IHR, we appreciate the importance and benefits of effective preparedness and response to public health emergencies. We note with appreciation WHO support provided to countries, South Africa included, from the beginning of the pandemic, including the creation of platforms to continue guiding countries in their efforts to respond to the COVID-19 pandemic and learning from each other as pandemic unfolds. The COVID-19 pandemic has highlighted the importance of IHR and the primary role of member states in preparing for and responding to outbreaks and emergencies. WHO has maintained its leadership position in the global response throughout the pandemic, while concurrently managing 65 graded emergencies over the 2020-2021 period. We acknowledge the central role played by the WHO in our efforts to fight emergencies and pandemics, and support the call to ensure available sustainable resourcing for a strengthened WHO. This will ensure that WHO is able to act appropriately in response to future pandemics. We therefore support the resolution on strengthening WHO to deal with pandemics. Our government has been involved in the global level as the co-chair of Access to COVID-19 Tools Accelerator with Norway, and recognize progress made at the level in terms of resources mobilized for vaccine and tool, including the COVAX platform. However, we remain concerned with the unequal access to vaccines, which continues to persist. This is an inequality we could not have imagined a year ago, as we discussed principles of equity, access, and solidarity. However, we acknowledge with appreciation recent developments during the Global Health Summit with the announcement of countries' readiness to share vaccine doses with developing countries. We welcome this move and hoping that this will be realized to assist those countries who have not yet started with their vaccine programs to do so. This is demonstration and recognition of the importance of regional and global collaboration in fighting against the COVID-19 and will be for other pandemics and is encouraged. We further align with the panel's recommendation for a global instrument for pandemic preparedness and response on COVID-19, the pandemic treaty. We fully support the recommendations and request the Secretariat to put in place necessary measures to implement this recommendation. We welcome and support the resolution on local production, and that local production should ensure capacity building and making resources available for production of not just vaccines, but other tools and commodities. We urge the Secretariat to work closely with the regional offices and formations to ensure the implementation of this resolution. I thank you, Madam Chair.
Thank you, South Africa. I now give the floor to Sudan, to be followed by Madagascar.
Thank you. Esteemed Chair, members of the Health Assembly, ladies and gentlemen, we thank the DG for the reports on WHO's work on health emergencies and mental health preparedness for and response to the COVID-19 pandemic. We're committed to strengthening emergency preparedness and response and to solicit WHO's continued support in several areas, including the mental health and well-being in societies impacted by the COVID-19 pandemic. The demands of health emergencies continue to expand, and associated with that, mental health consequences are also more evident. In addition to the COVID-19 pandemic, we note that the WHO is currently responding to 65 emergencies from all hazards across the globe, 15 of which are in the Eastern Mediterranean region. This is one of the most emergency-prone regions globally, where over 100 million people across the region currently require humanitarian assistance, 43% of the globe total. Within the region, progress is being made in professionalizing the management of health emergencies through a comprehensive approach of prevention, preparedness, response, and recovery. This progress has been best reflected in the response to the COVID-19 pandemic, but there are many other examples also, such as the rapid and effective response to the port explosion in Beirut last August. Nonetheless, more work is required, especially in the area of preparedness and strengthening IHR core capacities. The lessons learned from the COVID and the major reports presented today will inform the further strengthening of our overall health emergency management capacities. Special attention must be paid to the protracted humanitarian crisis, where we consistently observe a convergence of humanitarian and health security priorities. We encourage the consistent application of the humanitarian development peace nexus in such settings. The mental health dimension of emergencies also require far more committed attention. This is no better reflected than by the impact of the COVID-19 pandemic is having on the mental health and well-being of whole societies. We make a strong and clear commitment to integrating mental health fully into the preparedness, response, and recovery plans for the COVID-19 pandemic. But this commitment must go beyond the pandemic. Mental health and psychological consequences are evident in all emergencies. We must well-being when crises hit at all times. This will support the resilience of individuals, families, and communities. Now more than ever, the global community must remain focused on accelerating the implementation of the 2030 Sustainable Development and the humanitarian agendas. Addressing the issue of mental health is critical to achieve the related goals. As we heed the advice of making greater investments in health emergency preparedness, we must ensure those investments also support mental health and well-being. Thank you, Chair, for your time.
Thank you, Sudan. I now give the floor to Madagascar, to be followed by Mexico.
Thank you very much, Madam Chair. Madam Chair, ladies and gentlemen, dear ministers, dear delegates, Madagascar is very pleased to give its statement on universal healthcare in the pandemic of COVID-19, and we align ourselves with the statement made by the representative that made their statement on behalf of AFRO. All people have been affected by COVID-19 around the world, especially in Madagascar, and in 2015, we have started to see some epidemics arise in Madagascar. Governments, during health emergencies, have carried out emergency actions. However, their means are very limited. Countries, as well as the international community, have to work hand in hand. The risk is having an approach that is too limited and that privileges only short-term interest and that opposes health security and universal health coverage. Therefore, we need to adopt very clear public funding policies for health needs. Universal health coverage and health emergencies are closely linked. We shouldn't choose one or the other. We have to understand the actions that are necessary in terms of services in healthcare. We also need to make sure that we understand what is necessary in terms of governance and funding. We need to guarantee sufficient funding for public health goods, as well as the public health functions. We need to make sure that we have laboratories, data systems in place, information systems in place, regulations, and we also have to carry out public health awareness campaigns. We have noticed that in many different countries, funding for these types of activities is not guaranteed. We need to find a solution to this to be able to reinforce these mechanisms that are activated when there are health emergencies. We also need to have routine healthcare treatments and medical products available at all times. We need to work with our technical and financial partners, and this can be spearheaded by the WHO. We hope that we are now laying the basis for a solid foundation for healthcare systems that are better prepared for the future, especially when it comes to emergency situations. We need to make sure that public health resources are increased, especially those that are provided to us by donors. This will help us deal with public health emergencies such as new infections when they crop up in our countries. We must prioritize the budget that is allocated to health emergencies. Likewise, we should also institute new mechanisms of coordination to make sure that the funds are fairly allocated for a proper response. Madam Chair, we would like to appeal to international solidarity to continue working together against this pandemic and to be able to face national health emergencies that arise in the future. Thank you.
Thank you, Madagascar. I now give the floor to Mexico, to be followed by Peru.
Thank you very much, Chair. Muy buenos días desde México.
Good morning from Mexico. We would like to greet the presidency of the World Health Assembly that is leading this segment, as well as all the experts of member states that are represented here today in our session. Ladies and gentlemen, in Mexico, just as in other countries, the pandemic due to COVID-19 transformed our way of interacting with people that require mental health attention, especially due to social distancing measures. As the pandemic wore on, more and more people required psychological treatment or psychiatric treatment, which was the case of healthcare personnel that are on the front lines. Also, children and adolescents needed to adapt themselves dramatically to another reality. There were professors that had to find new resources to be able to continue with their careers. Families saw themselves very far away from each other, and there was also an increase in violence. There was the loss of relatives, and there were many other situations that we had to deal with in Mexico. In this context, our government has carried out several different activities. One of the activities was adopting the mental health strategy during COVID-19. Its objective is to coordinate activities that are interinstitutional to provide people suffering with mental health disorders treatment and help. This was done in the different phases, different waves of COVID-19. Amongst the main activities that were carried out and that are continuing are the following. We had many different workshops and courses that were directed towards healthcare personnel, paramedics, students, children, people living in situations of vulnerability, and the public in general. We also had a campaign that was launched on social networks on the prevention of risk factors. We spoke, for example, during these campaigns about psychological effects of having to do with staying at home for a very long time, problems linked to living together in small spaces. We raised awareness on the acts of violence, the increase in the consumption of substances, as well as strategies to deal with all of this, such as the strategies to reduce stress or to provide emotional support. We also published many different leaflets on mental health and on psychosocial support that were available in psychiatric hospitals. We also put together plans in terms of psychiatric help. There were training sessions on mental health. There were first aid sessions that were really focused on psychological assistance and interventions during times of psychological crises. We worked with the community centers of mental health, psychiatric hospitals, the state departments that deal with addictions, primary health care centers that are to do with addiction. And this was throughout the country. With the help of civil society organizations, we were able to provide consultations on mental health. We were able to provide psychological first aid, interventions during crises, counseling sessions, also therapy sessions due to the loss of relatives. All of this is added to the hotlines that we implemented, as well as the social networks that we set up to help people get in touch with the therapeutic centers that help them with the psychological support. And this was done 24 hours a day, 365 days a year. To also be able to deal with mental health problems in COVID, we had the first fair of mental health in Latin America and the Caribbean in Mexico. And this was meant for Mexicans that were living in countries in the region. We are also working with healthcare authorities in Italy to implement joint healthcare services. And this will be done remotely. I would also like to highlight that we are continuing on the National Strategy for the Prevention of Addictions, which is called Together in Peace. The objective of this campaign is to have an impact on the biopsychosocial determinants that will reduce the use of psychoactive substances in children. And this will help with the construction of peace and will also help with promoting and protecting human rights. And this will decrease the gap that exists in attention that is given to mental health and treatment that is given to mental health. Dear authorities and delegates, these are only some of the examples of the activities that we have been able to carry out to improve mental health and addictions in the context of COVID-19 in Mexico. We would like to know more about the successful experiences that you have had in other countries to be able to undertake them in our country as well. Thank you very much.
Thank you, Mexico. I now give the floor to Peru, to be followed by Tunisia. Peru, we can hear you. Please begin your intervention.
Do you see me? Do you hear me, please?
Yes, we can hear you and see you. You may now begin.
Thank you very much. We would like to express the recognition of Peru to those who are fighting on the front lines every single day against this pandemic of COVID-19. We would also like to express our solidarity with those who have lost loved ones and those who have been affected by COVID-19. The sluggishness of the response of COVID-19 highlights the lack of global preparation, which has led to a multidimensional crisis that endangers the sustainability of many of the achievements that we have realized in the past. There is a deep inequality that we have seen in the access and distribution of vaccinations at COVID-19. And this shows at what point international solidarity and cooperation is so necessary. And for now, words have not yet been joined to actions. There is still an incredible inequality in access. It is fundamental that we change this and we do not repeat the same mistakes in the future. And crisis such as this one requires a global response. We must take action. To do so, we support the creation of a draft resolution that would create a working group on strengthening preparedness and the WHO's response in emergency situations. This would help us assess the recommendations of different mechanisms of response to COVID-19, such as the IPPPR, the Review Committee of the IHR, and the IOAC. Peru welcomes the presentation of all the reports of these mechanisms, and we express our commitment to work in a constructive way during the work of the working group to analyze all of these recommendations. We hope to be able to identify concrete actions that will allow us to work together and to put into action multilateral efforts. We hope to also be able to implement IHR adequately. Likewise, Peru expresses its co-sponsorship to the draft decision to convene an extraordinary meeting of during this assembly to consider the setting up of an international instrument on preparedness and responses during pandemics. Dear Madam Chair, our commitment to multilateralism has become a reality through our participation in the COVAX facility mechanism. To be able to provide equitable access to vaccinations, it is necessary to visualize and deal with the situation that low middle income countries face. A simple global division between countries that are high income and low income, on the other hand, hides the enormous and urgent challenges that countries such as Peru face in terms of access and distribution of vaccines, treatment, in particular oxygen, diagnostics, and PPE. A true global response has to start from the recognition that vaccines and other tools are really public health goods. Peru will continue supporting the strengthening of multilateralism and of the WHO, as well as all the efforts that have been undertaken to reinforce global, regional, and national capacities in terms of preparedness and response to emergency situations and future pandemics. Thank you very much.
Thank you, Peru. We will now go to Tunisia to be followed by Thailand. I understand that Thailand has a video.
Madame la Présidente.
Madam President, Excellencies, colleagues, Tunisia fully aligns itself with the recommendations and WHO conventions, and we would like to say that the arrival of the COVID-19 epidemic in our country as of March 2020 demonstrated the significant demand for mental health care among our population, but also among health care personnel. And this was the reason for the strong mobilization of carers working in the area of mental health, and for the establishment of a free psychological support platform led by the Ministry of Health's Psychological Assistance Unit, with a collaboration of private volunteers, medical students, psychologists, private psychiatrists, as well as non-governmental associations. Recent events have confirmed the increase in psychological suffering and the significant emotional impact of the pandemic, with the possibility of emerging mental disorders. In this context, the Ministry of Health has implemented psychological assistance units for healthcare staff among different healthcare structures at a second and third country level in order to provide them with close support and a better psychological treatment. These units will be made available in a second phase to cater to the needs of the general population. Each of these units comprises a doctor trained in psychological support and/or one or several psychologists. In a number of regions where the availability of public psychiatrists is not guaranteed, private psychiatrists and psychologists have volunteered within these units, and the goal of such units is to recognize the suffering of healthcare workers and to ensure early treatment and high-quality support. As part of these efforts, these units ensure that a preventive role is carried out through psychoeducational work carried out during awareness-raising sessions, and also screening activities take place to identify persons who are presenting clinical manifestations of a pathological order, and they also serve as providing information in simple and accessible language on health strategies, and they also provide useful telephone numbers and addresses to consult if necessary.
Thank you, Tunisia. We will now go to the video from Thailand, to be followed by the video from Georgia.
Excellencies, I am speaking as the steering group chair of the Global Health Security Agenda. Addressing pandemics requires country capacities to prevent, prepare, detect, and respond. GHSA, a multilateral initiative of more than 70 countries and partners, strengthens country capacities to prepare for pandemics. GHSA reinforces achieving the goals of the international health regulations and other global health security frameworks. Hence, the GHSA strives to make the world safe from global health threats posed by infectious diseases. GHSA functions through its governing body, the steering group, chair, secretariat, permanent advisors, task forces, action packages, and contributing countries in implementing the 2024 framework. GHSA functions through the whole of government, multi-sectoral, and One Health approaches at the country level. At the global level, as the United Nations General Assembly resolution recognized the importance of global solidarity in fighting the COVID-19 pandemic, GHSA confirms the importance of these cross-border multilateral efforts. Robust health security systems and universal access to prevention, diagnosis, treatment, and vaccines are keys for effective responses to pandemics, while health system capacities can be maintained to sustain essential health services such as treatment and prevention of life-threatening diseases, notably those under the Sustainable Development Goals. Chair, Thailand hosted the 6th GHSA ministerial meeting, where country leaders in global health security committed to intensify efforts in achieving the GHSA overarching target by applying the whole of government and whole of society approach. The multi-sectoral One Health approach would be enhanced. Surveillance and early warning systems would be strengthened. For more effective responses to the current and future pandemics, there would be more timely access to all relevant medical supplies. The environmental sector would be encouraged to fully engage with others at global and national levels. Ministers also reaffirmed their commitment to enhance resilience of health systems through strengthening essential health services during pandemics must be maintained. Global solidarity is crucial for building country preparedness against global health security threats and the mitigation of impacts due to pandemics. As the chair of GHSA for this year, I reaffirm that GHSA will continue our commitment to strengthen country capacities to prevent, prepare, detect, and respond for global health security infectious disease threats. Thank you.
Thank you, Thailand. I now give the floor to Georgia, to be followed by the Republic of Moldova.
Honorable Chair, esteemed Director General, distinguished delegates, from the outset, I thank you, Director General, for presenting the report on implementation of the resolution WHA 73.1 on COVID-19 response. We much appreciate the World Health Organization's invaluable support rendered to Georgia in the fight against COVID-19 pandemic. Despite huge efforts of the countries, the global pandemic is still in active phase and unfortunately, death toll is still high. It's noteworthy that new, more acute challenges are emerging during the pandemic, which complicates the management of the process. That's why our primary goal should be improving preparedness at national and the global levels, since we still do not know what kind of new challenges we will have to tackle. Time has a critical importance in terms of addressing challenges of the pandemic. We should be flexible and consistent while making decisions. First of all, we need to evaluate main gaps and outline prior needs, which will lead to the development of effective response mechanisms. To overcome pandemic challenges, it is essential to sustainably improve comprehensive mechanisms, such as active biosurveillance and epidemiological prognosis, as well as build capacities for diagnosis and treatment, and more importantly, enhance preventive measures. At the early stage of the pandemic, our main tool against the spread of the virus was personal protective equipment, enhanced hygiene measures, and social restrictions. Today, we have vaccines, the main weapon to end the pandemic. Ensuring equitable access to COVID vaccines has a critical importance for all the countries. Also, it's essential to improve equitable access to all public health benefits that are key tools in combating pandemics. Georgia is a good example of transforming challenges into opportunities. Due to the urgent needs in the pandemic management process, the country has taken important measures to improve the sustainability of healthcare system, including medical infrastructure, health personnel, and clinical management capabilities. Besides, completely new approaches and innovative technologies were introduced that have been endorsed by our international partners. However, despite all the achievements, new and difficult challenges are still ahead. With joint global resources, with equitable distribution of vaccines, and with sharing best practices, we, without any doubt, will end the pandemic. I thank you for your attention.
Thank you, Georgia. I now give the floor to the video that is from the Republic of Moldova, to be followed by Tonga.
Ladies and gentlemen, the COVID-19 pandemic as the public health emergency of international concern have required implementing comprehensive public health measures and mobilizing health and the non-health sector and the whole society. The Republic of Moldova, in the context of COVID-19 response, have been working to strengthening health system capacity and to develop and maintain core capacities in the point of entry. The IHR monitoring and evaluation performed by the country, such as joint external evaluation, inter-action review assessment of the core capacity in the point of entry, along with the annual state party self-assessment annual reporting, allow to identify gaps and areas for improvement and is built on the strong intersectoral collaboration and involvement in IHR implementation. COVID-19 pandemic demonstrated that both comprehensive expert-guided joint external evaluation and interaction review enable country to identify operational ways to manage the emergency by conducting periodic needs assessment, centralizing financing, mobilization, and procurement system with sufficient flexibility, mobilizing and motivating human resources such as students and residents, as well as rapid relocation and repurposing of beds and facilities in response to the increased number of hospitalization and maintaining emergency medical services throughout the pandemic. Based on the assessment results and in line with WHO recommendation, medium and long-term strategic direction have been identified to strengthening emergency response and management, such as revision and improvement of national legislation to approve the draft of the National Action Plan to strengthen the implementation of the IHR, the Public Health Emergency Preparedness and Response Plan for the health sector developed in 2020 based on the strategic risk assessment is to be tested in order to assure the health care with regards to emergency from one hand and the essential health services on the other hand. Strengthening of the core capacity in the point of entry to provide public health emergencies and the disease control activities, strengthening human resources through training in the field of emergency management, strengthening the surveillance system for communicable diseases and public health events, as well as the implementation of IT solution for data collection and exchanging. In the conclusion, I would like to express our gratitude for technical support on the evaluation conducted, as well as the overall support in managing the COVID-19 pandemic and further strengthening of the public health emergency management.
Thank you to the Republic of Moldova. We will now go to the video from Tonga, to be followed by the video from Tuvalu.
Honorable Chair, WHO Director General Dr. Tedros, Your Excellencies, Maloe Lele from the Kingdom of Tonga in the South Pacific. I am proud to say that Tonga is one of the few countries in the world to be still COVID-free. As Honorable Prime Minister has addressed in the opening session, Tonga took immediate action starting in February 2020 and taking heed of WHO early warnings. We declared COVID-19 a national public health emergency in March 2020, worked on infrastructures to serve as quarantine and treatment centers, and established a new lab for PCR testing. We trained our health staff so that they would be ready to treat cases. We engage with communities to improve prevention measures such as hand washing and physical distancing. And now we are working to vaccinate the population. And to date, we've reached more than 25% of our target population, including more than 1,000 non-Tongan nationals. This is the Kingdom's steadfast commitment to ethical, equitable access for vulnerable population, and of course, including our elderlies, disabilities, and prisoners. This is all possible with powerful support and collaboration between all sectors of our society, as mighty support from the 100,000 local communities and islands. They are our heroes who have sacrificed during the pandemic and are still forging forward together with the Ministry of Health to save our micro-population. Of course, none of this would have been possible without the support from the WHO. I echo the Kingdom's most sincere thanks to Baito Hemoui Mapu Avaya, the Director General Dr. Tedros, Tongan name, for his courageous ethical leadership, and WIPRO Regional Director Dr. Takashi Kasai for inclusive and always keeping the Pacific Island countries on his radar. In addition, we have received technical and financial assistance from different development partners, including the Asian Development Bank, Pacific Community, World Bank, and the governments of Australia, China, India, Japan, New Zealand, United Kingdom, and the United States of America, along with the support provided through those behind COVAX, such as the European Union. For this, on behalf of His Majesty's government, the Honourable Prime Minister and the Kingdom of Tonga, I would like to convey our most sincere gratitude to the brave leaders of the developed world and their commitment to equitable access of vaccines for the vulnerable Pacific Islands. Of course, the threat is far from over. The number of cases recorded across the globe is still hitting the highest. Every day, there are thousands of deaths and people grieving behind each death. Recognizing that the threat posed by COVID-19 is likely to continue, we need to remain vigilant, strengthen and upgrade systems, and ensure involvement of all sectors for coordinated whole of government, whole of society actions at national, subnational, and local levels.
Thank you so much to Tonga. We will now go to the video from Tuvalu.
Excellency, ladies and gentlemen, I am pleased to give this statement on behalf of Tuvalu. Today, Tuvalu remains COVID-19 free. However, we continue to witness the devastating impacts of COVID-19 and emerging variants around the world. Our thoughts and prayers are with the families of those who have lost loved ones to this deadly virus. We applaud the continuous efforts of all health workers and response teams around the world. Tuvalu continue to strengthen our system to ensure the maximum protections of our citizens through mobilizing a multi-sectoral coordination through a national planning and response task force and subcommittees, improving public health, surveillance and risk assessment, preparing our testing laboratory and health facilities, maintaining essential health services for our people, strengthening our infection prevention and control mechanisms, instituting non-pharmaceutical public health measures, and keeping our community informed through regular national press conference, radio, TV, and social media postings. We are grateful for the receipt of the WHO-approved AstraZeneca vaccine from COVAX. Our health workers continue to administer first dose of the vaccine, with the second dose to be administered after 10 to 12 weeks. The emergency of more COVID-19 variants is a wake-up call to developing countries to hasten the developments and equitable distributions of safe COVID vaccines. Despite the huge challenges posed by COVID-19 and other infectious diseases, we continue to also focus our effort in managing non-communicable disease, as they are the leading cause of mortality in Tuvalu. Hence, strengthening Tuvalu's primary health care systems remain a priority, including updating and enforcing laws, regulations, and policies, providing training for our teams, encourage our community, all effort to reduce the burden of communicable disease and non-communicable disease. Tuvalu acknowledges the support of our response efforts from technical agency and development partners. These include the governments of Taiwan, so I take this opportunity to reaffirm Tuvalu's goal, the inclusion of Taiwan in the World Health Assembly. Thank you to the World Health Organization for contributing to support, especially acknowledging the leadership of Dr. Kasai. Lastly, as per this year's theme, Tuvalu stands with you as the pandemic prevent the next and build together a healthier, safer, and fairer world. Taftelas, and God bless you all.
Thank you, Tuvalu. There are no further requests from the floor from member states for item 17.1. We will now continue with the list of observers. In accordance with the rules applicable to observers at the World Health Assembly, I have the pleasure to give the floor to the representative of IFRC, to be followed by Gavi.
Excellencies, the COVID-19 pandemic has impacted all young people, with 90% reporting increased mental anxiety, more than 1 billion impacted by school closures, and 1 in 6 losing their jobs. A generation disrupted. This is why an alliance of the Big Six youth organizations, composed by the International Federation of the Red Cross and Red Crescent Societies, World Organization of the Scouts Movement, World Young Women's Christian Association, World Young Men's Christian Association, the Duke of Edinburgh International Award, the World Association of Girl Guides and Girl Scouts, has joined forces with the WHO and UN Foundation to launch the global youth mobilization. Together, our Big Six organizations collectively support more than 250 million young people every year. The global youth mobilization is a movement taking action to improve communities and young people's lives now in a post-COVID-19 world. We are investing more than $5 million in local and national youth organizations, including direct microfunding for youth-led solutions. In April, we organized a virtual global youth summit gathering over 14,000 young people from 152 countries in interactive sessions with over 50 partners. Following the summit, we are calling on governments, companies, and policymakers to support us to invest and scale up youth-led solutions and youth development programs across the world in response to the pandemic. The mobilization supports young people by equipping them with the skills for life, by providing safe spaces for their development, and giving them the confidence to discover their potential and challenge the status quo. We invite you to join by investing in young people, their ideas, their creativity, and their talents.
Thank you, IFRC. I now give the floor to the video from Gavi.
COVID-19 has highlighted the severe inequities associated with access to vaccines to address a global pandemic. It has also highlighted the contribution of routine immunization and strong health systems to pandemic preparedness and response efforts. COVID-19's immense social consequences are felt in every community and every country on Earth and have caused an estimated $11.5 trillion in economic loss. COVAX is the only globally coordinated effort to guarantee fair, equitable, and timely access to safe and efficacious vaccines. COVAX has delivered over 67 million doses to 124 economies globally. With more financing available, we can deliver 1.8 billion doses and protect 30% of population in AMC countries by 2022. Gavi calls upon member states to support COVAX by 1. Raising an additional $1.6 billion by June 2021 to deliver 1.8 billion doses by 2022. 2. Sharing COVID-19 vaccines through COVAX. 3. Removing trade barriers, export controls, and other transit issues to ensure distribution of COVID-19 vaccines and ingredients to those most in need. And 4. Support technology transfer and ramp-up of manufacturing capacity to ensure equitable access. COVAX calls upon member states to include populations with a higher risk of developing severe COVID-19 symptoms and the most vulnerable, regardless of their legal, social, and economic status, in COVID-19 national vaccination plans in line with the SAGE recommendations. And to maintain, restore, and strengthen routine immunization, prioritize reaching zero-dose children and marginalized communities, including through greater focus on community engagement, to strengthen health security and pandemic preparedness, and to strengthen pathogen surveillance and reporting capacity to ensure high coverage of diagnostic services on a subnational level and timely detection of outbreaks. Thank you.
Thank you to Gavi. I now give the floor to Colombia. Colombia, you have the floor.
Gracias. Thank you. Thank you very much, Madam Chair. We would like to thank the Secretariat for the update on the implementation of Resolution WHA 73.1 on the response to COVID-19. In this respect, we commend the efforts that have been undertaken by the organization to support a comprehensive response and effective response to the current COVID-19 pandemic that has turned the world upside down and that has put our health systems to the test. We would especially like to thank countries that have helped us in the drafting of national preparedness and response plans. We hope to be able to continue with this support in this effective implementation of these plans of action. Currently, we are making great efforts to be able to alleviate the social and economic effects of this pandemic, and we have been tirelessly working to be able to find integrated solutions. In line with this, Act A is of special importance now because it represents a global push to find a quick exit out of this crisis. Colombia is committed to Act Accelerator, and we have committed ourselves to Act Accelerator not only with financial resources, but we have also participated through clinical trials. We have also participated and we have promoted the COVAX facility, which we see as a fundamental tool in terms of ensuring equitable access to vaccinations. Nevertheless, we are very aware of the current challenges that countries face when it comes to the COVAX facility. There are many challenges with the COVAX facility. There are many low and middle income countries that are dealing with the low availability of vaccinations. And this is why we are making an urgent appeal to mobilize the necessary support that is needed for the COVAX facility. We hope that the countries with surpluses of vaccines will be able to fairly distribute them to all other countries. We also have to take into account the different demographic, social, and economic factors that have a direct impact on the situation of each country dealing with this pandemic. We are aware of the efforts that the organization has deployed to adapt its response to the current emergency without neglecting all the other strategic priorities of the global program of work. This balance will be necessary to be able to fully attend to the challenges that remain in public health areas, as well as those that crop up because of emergencies. We need to really have a One Health approach. Lastly, we know that the organization requires the support and commitment at the political level, at the financial level, and technical level to deal with this current emergency and to strengthen its response for future emergencies. In line with this, we are making an appeal to countries to renew their commitments to the organization and to work hand in hand with the WHO in strengthening the work of the WHO. Thank you very much.
Thank you, Colombia. There are no further requests for the floor from member states for item 17.1. In conformity with Rule 47 of the Rules of Procedure of the World Health Assembly concerning the representatives of the United Nations and of other intergovernmental organizations, I would now like to give the floor to UNFPA, to be followed by the International Atomic Energy Agency.
Thank you, Madam President. UNFPA welcomes the report on the COVID-19 response by the Director General, outlining the challenges faced by women and girls, as well as health and social protection systems, which UNFPA is helping to address in over 150 countries. The pandemic has resulted in irreparable loss of hundreds of thousands of lives across the globe, and has put health systems in developed and developing countries under enormous stress. While priorities still and should continue to be concentrated on saving lives, UNFPA's latest data provides a stark picture of the broader impact COVID-19 pandemic is having on the rights, health, and well-being of women and girls. UNFPA projects the pandemic could result in millions of more cases of gender-based violence and unintended pregnancies. We have already seen setbacks in efforts aimed at preventing child marriage and female genital mutilation, as girls are no longer in schools and therefore more vulnerable to be married off or mutilated against their will. Essential sexual and reproductive health services have been limited as a result of containment measures and movement restrictions. Moreover, fears of contracting the virus in health centers are preventing women from seeking those services. Loss of income has limited access to service, medicines, and contraceptives. Furthermore, many healthcare providers working on sexual and reproductive health, for instance, midwives, have been redeployed to support the treatment and care of COVID-19 patients, but have not been prioritized in the distribution of personal protective equipment required for them to operate safely. Mindful that women represent 70% of the global health workforce, often performing tasks that place them at an increased risk to get infected and suffer burnout, UNFPA has been at the front line of supporting health workers, including the delivery of personal protective equipment. Moreover, we have been actively advocating with governments to ensure sexual and reproductive services are an integral part of governments' response plans. Some concrete measures have included the strengthening of health systems' capacity to deliver safe and quality services for pregnant and lactating mothers.
Thank you, UNFPA. Thank you, UNFPA. Your time has now elapsed. We now give the floor to IAEA, to be followed by IOM.
The COVID-19 pandemic has highlighted the critical importance of international cooperation during a global crisis. The IA is proud to work with WHO and be part of the UN Crisis Management Team. The IA has a long-standing experience in assisting countries in tackling animal zoonotic diseases, such as avian influenza, Ebola, MERS, and Zika. In response to the COVID-19, the IA activated its biggest cooperation project in its history. With the support of member states, the IA has assisted 286 laboratories in 128 countries and territories around the world. The IA assistance included the provision of equipment and materials, as well as technical advice and guidance to individual laboratories. The experience with the COVID-19 pandemic has highlighted the scientific and infrastructure gaps among countries to have a coordinated response to deal with the outbreaks of zoonotic diseases. Stemming from the IA's long-standing experience and by the recognition that many countries still do not have the basic infrastructure to detect zoonotic diseases, the IA's Zoonotic Disease Integrated Action Project, or Zodiac, aims, among others, to enable countries to access to training, equipment, expertise for the implementation of detection and diagnostic techniques. Zodiac ultimately aims to enable laboratories to produce quality information for science-based decision-making by the country, as well as the international community. The IA looks forward to continuing our close collaboration with all the stakeholders in this endeavor.
Thank you to the IAEA. I now give the floor to IOM.
Honorable Chair, Director General, distinguished delegates. While many have faced huge health and socioeconomic impacts from COVID-19, migrants and displaced populations have been especially vulnerable to the pandemic's consequences. In coordination with WHO and key partners, IOM has addressed the health needs of migrants, including internally displaced persons, as part of its overall COVID-19 strategic response and recovery efforts. For example, in 2020, more than 38,000 trained community health workers implemented RCCE efforts as part of IOM programming. IOM supported over 1,000 points of entry to undertake COVID-19 preparedness and response measures, including capacity building activities. IOM continued to support the resettlement of refugees through testing and treatment for both communicable and non-communicable diseases, vaccinations, and facilitation of travel in COVID-19 context, assisting close to 50,000 refugees. The IOM First Line of Defense was implemented in 18 countries and assisted over 7,000 eligible UN personnel and their dependents with COVID-19 testing, telehealth, medical movement support, and other services to stay and deliver. On COVID-19 vaccines, in line with UHC principles, we must ensure that all migrants, no matter their legal status, have equitable access. Significant barriers faced by migrants in accessing COVID-19 vaccinations remain, such as the need for specific ID, absence of firewalls between health and immigration authorities, linguistic and cultural barriers, to name a few. Noting the report of the Independent Panel for Pandemic Preparedness and Response, IOM, including as a coordinator for the UN Network on Migration, will continue advocating for and supporting member states on the inclusion of migrants in national COVID-19 response and pandemic preparedness plans, as well as essential health services. The UN system, through the network, stands ready to support governments in addressing and reducing vulnerabilities faced by migrants. Thank you.
Thank you to IOM. I would like to remind our non-state actors that their interventions will be taken under grouping 17.3. Madam Chair, there are no further requests for the floor for grouping 17.1. I now give the floor back to you.
Thank you very much. I'll now give the floor to Dr. Michael Ryan. Dr. Michael Ryan, you have the floor.
Thank you, Chair. And I will again try to keep my commentaries brief so as to facilitate the Chair's challenging job. I would say actually very deeply and sincerely on behalf of all of the staff of WHO at all levels, and all of our partners, say thank you to the member states for the way in which each and every one of you have recognized the huge efforts by our staff, their outstanding commitment to their jobs, going above and beyond the call of duty, delivering more than I or the Director General or the DDG could ever have imagined could be delivered by such a small group of people. But it is amazing what a small group of dedicated people can do when they're stimulated by the desire to save lives and to support you, our member states, and the communities that you support. So I'm sure every staff member around the House is very proud today and very proud to be WHO in your service and in the service of communities all over the world. A number of issues were raised, and I must say very consistently between the last session as well. So I'm not going to relitigate all of them, but certainly a huge focus on improving global surveillance and pathogen surveillance, a focus on understanding variants more and expanding sequencing. And we've taken all that on board, and obviously we will continue to work on that. We will work with the G7 and Pathogen Surveillance Initiative. We will continue to work to implement the WHO Hub of Berlin. We will extend all of our partnerships and the epidemic intelligence from open sources and other initiatives to create a truly consultative process for developing a new framework for global surveillance, but with a strong focus on local surveillance as the major objective. Global surveillance does not work. I've said it many times. Global weather forecasting does not work. The supercomputers do not work unless people walk out onto mountaintops every day and measure the wind speed. That is done by ordinary people everywhere in the system every day, feeding information into a global system. If we put rubbish into the global system, we will get rubbish out. So we need to focus on the local capacities to measure health, local capacities to detect unusual events, but be able to bring that data centrally very quickly to assess it, to assess its relevance and importance and danger for others. Many of you mentioned, again, the health workforce and our health and care workers. And again, you highlighted and celebrated the sacrifices that they have made, and so did the Director General in his speech. But praise does not solve the frustration of our health workers. They have not been adequately protected. They have not been adequately trained. They have not been adequately resourced. And having been a frontline health worker in dangerous pathogens outbreak, the danger to yourself is something that is very, very unsettling. But the greatest frustration is not being able to help the people who you have in front of you because you don't have therapeutics, or you don't have oxygen, or you don't even have a bed. So if we're really to do justice to our health workers, we have to equip them, train them, protect them, and ensure that they can do what they do best, which is save lives. And I think that was very much a central theme of the DG speech. It was a central theme in all of you, what you said. And I'm sure health workers around the world are not only beaming with pride today, but you've generated huge expectations in them for what we will do next as a collective. A lot of focus again in your presentations on One Health and taking a multi-sectoral approach, and clearly that's a major theme, on focusing in on vulnerable populations and ensuring no one is left behind. Migrants, refugees, people who live outside the system. If we leave anyone behind, we are all at risk. Many of you spoke to the issues of mental health, and I think this has been a hugely under-recognized and under-responded to element of this epidemic, as it is in all emergencies. My colleague Deborah Costello here from the Mental Health Department, and I know it comes up next, but it's something very close to all our hearts. We've seen the terrible toll taken on communities and health workers and others. Our mental health, our psychological well-being is hugely important to us all. So many thanks for raising those issues. Again, you raised the issues and the challenges of dealing with misinformation, disinformation, risk communication, the science of trust, and dealing with infodemics. And I think WHO has really taken major steps forward in this space over the last number of years, particularly with DepiWin and infodemics initiatives, and we continue and are determined to continue doing so. Overall, your focus on community-centered approaches has been extremely welcome. There are some specific issues that were raised regarding the universal UHPR, the universal peer review of health and systems and health security systems. We very much thank the member states, 11 member states, I believe, Stella, who have agreed to participate as pilot projects or guinea pigs, whichever way you wish to look at it. But we very much appreciate those member states' transparency and determination to show the way. Cameroon, I think, were the country that raised that and are one of the volunteers. Again, other countries, we've done, 32 of you have done major exercises in the middle of this pandemic in order to look at your readiness. And there have been 61 intra-action reviews. And again, our team here and our team at the regions have adapted our after-action review methodology so countries could carry out intra-action reviews to look at their responses and adapt their responses. And again, we thank you for that innovation and for that flexibility. We also thank member states who both are hosting and contributing to the biohub concept of bringing together pathogen specimens, allowing WHO to add another, we hope, flexible and successful mechanism to the world's need to move specimens around as quickly as possible during a crisis. Second, lastly, I would just, lastly, on origins, I think there was a lot of questions from member states on the origins, and I just want to reassure everyone that, and well, first of all, to thank the team that did go to the field. There was tremendous amount of work done before, during, and after that mission. And we thank our Chinese colleagues for their collaboration and the international members who came from abroad. Many of you said that this was a major first step, this was groundbreaking, this produced tremendous amount of very useful information, but it was a step. It was not the final step, it was the first step. We continue to work with many of you. We've had consultations informally with many member states to look at what happens in the next phase, and we will continue to have those discussions in the coming weeks. We clearly have laid out, or the team had laid out in its report, a series of further studies that need to be carried out. We've received inputs from many of you. We continue to and are very much welcoming of your suggestions around those inputs for the next phase and around the need for further experts to be able to carry out different studies or support the implementation of different studies as needed. The Director General will consider all of that in the coming weeks, and we will then be able to communicate with you what we believe is the best next step in this journey. Finally, it would be important to speak on many of you mentioned the issues of research. And this has been research and innovation, research and development have been a huge part of this response. We would like to give a shout out to the thousands of researchers, over 3,000 researchers in 134 countries, 40% of whom are in LMICs, who are part of WHO's R&D Blueprint for Epidemics, and specifically the Research and Innovation Collaboration Platform for COVID-19. In excess of $5.7 billion has been invested in the research alone around this pandemic. It's an incredible explosion of research funding. We have aligned priorities and aligned funding in diagnostics and vaccination and ethics and PPE and clinical, IPC, animal, human, and epidemiologic investigations in 8 areas with 15 working groups. This work is not done by one person, by one team, by one program, or by one organization. This is a trans-organizational effort called the R&D Blueprint for Epidemics. It represents the core of the transformational agenda that the DG has pursued, and Bruce pushes us along the road. The key to this is this involves many programs in WHO, but in particular, my colleague and partner in this is Dr. Sumya Swaminathan. This is very much a collaboration of the Emergencies Program with the Science Division, and Sumya may wish to take the floor if she would, because there's a lot happening in this space, and in particularly around the solidarity trials, which many of the member states raised. So Sumya, please, and then back to you, Chair, after Sumya speaks. Thank you all.
Thank you very much, Dr. Ryan, for your words. I will give the floor to the next speaker.
Thank you, Chair. And I would like to thank again all the member states for their remarks and the positive remarks that have been made about the collaborations that we have seen over the last year and a half around science and research. As Dr. Ryan just said, I think we've had a very good experience on the science side by bringing together researchers, academics,
scientists from all countries around the world, with the first Global Research and Innovation Forum in February of 2020, following which multiple expert groups and advisory groups and networks of people were set up and have continued to work and collaborate with the spirit of open sharing of research, of data, advancing the science as quickly as possible. In fact, even today there is a meeting going on, a webinar on defining the correlates of protection, which, as you all know, is very, very important to advance vaccine trials and to understand protective immunity. And when I last left that meeting, there were over 1,500 individuals participating in that webinar. So a lot has been achieved, and it's thanks to the efforts of people around the world. Many of you mentioned the Solidarity Trial for Therapeutics. This was a very successful trial that was launched again April of 2020, that involved over 500 institutions and hospitals with hundreds of principal investigators across 30 countries. The first phase studied 4 repurposed drugs, and the next phase, which is due to begin very soon, will be testing a few more immunomodulatory drugs, which we hope will have some impact in moderately severe and critical illness. We are also planning the Solidarity Vaccine Trial platform, which will help us to advance vaccines that are coming up from the smaller companies, from the biotechs, the second generation vaccines that still need to go through clinical trials. And we look forward again to collaborating with all of you to make this a success. The Science Division has worked with the Emergencies Program, but also with the technical programs across WHO and across the 3 levels of the organization with our regional offices and our country offices to try to bring the highest quality evidence into the guidance that's been produced by WHO, which has been challenging at times because the science has been changing and advancing on a daily basis. And that's why we've now moved to what we call the living guidelines, the guidelines that get updated as soon as new evidence is available, so that we present the latest to you, member states, to adopt into your national guidelines. Thank you very much for this opportunity.
Thank you very much. I understand that there are some member states willing to speak, so I would like to give the floor to the moderator to manage those member states, and then we carry on with the agenda.
Thank you so much, Madam Chair. I understand that there are member states who had raised their hands this morning who are now available to provide their interventions on item 17.1. Norway, you have the floor, to be followed by Sri Lanka.
Thank you, Chair. The daily global COVID-19 case count has never been higher at any other point so far in the pandemic than in the days and weeks leading up to this year's Health Assembly. Our work to limit the impact is far from over. First, we must increase our efforts to minimize the devastating effects of COVID-19 on individuals, on societies, and on the global community. This means continuing to implement public health and societal interventions based on best available evidence, and ramping up efforts to ensure global access to tests, treatments, and vaccines that are safe, efficacious, and of adequate quality. It is essential that we continue increasing manufacturing capacity to increase global access to vaccines. We need full financing of the ACT Accelerator, and we must all, governments, multilateral organizations, and pharma industry included, increase our efforts to enable redistribution of vaccine doses from bilateral agreements. We need to manufacture as many doses as possible, and we need to ensure that all vaccines that can be used are put to good use. Norway has recently announced that we will share 5 million vaccine doses as part of Team Europe, with COVAX as our preferred mechanism for dose sharing. Furthermore, we must act now to take action on the lessons learned from this pandemic. The reports and recommendations from the Independent Panel for Pandemic Preparedness and Response, from the IHR Review Committee, from the Independent Oversight and Advisory Committee, and from the Global Preparedness and Monitoring Board provide us with the guidance we need to be better prepared for future crises. Our job is to find the best path forward to implement their recommendations. We have a responsibility to make this the main outcome of this Health Assembly. Norway commends the work WHO has done and continues to do so in response to the ongoing crisis. The pandemic demonstrates the pivotal role of WHO for all member states. We as member states have the responsibility to ensure that WHO has the resources and the independence necessary for the organization to be able to deliver on its mandate. Norway underlines the need to invest in long-term systems and infrastructure for pandemic prevention. This is best done through strengthening health systems, investing in universal health coverage, preparedness and control through binding international collaboration. IHR is a solid legal framework, but we agree with the need to strengthen implementation and capacity building in line with IHR requirements. The crisis also demonstrates the need for a more solid scientific foundation for understanding of epidemics and their spread. We need to evaluate the effects of measures, both pharmaceutical interventions and public health and societal interventions to stop the spread and to minimize negative implications of this and future pandemics. Thank you.
Thank you, Norway. I now give the floor to Sri Lanka, to be followed by Burkina Faso. This will complete all member states who had raised their hands for 17.1 this morning. Sri Lanka, you now have the floor.
Yeah, thank you, Chairperson. This is related to the item number 18. Sri Lanka hereby...
Sri Lanka, would you like to provide an intervention on 17.1?
No, this is regarding 18.
We will come to that in our next grouping.
Okay, thank you.
Thank you so much, Sri Lanka. Burkina Faso, would you like to provide your intervention on 17.1? Okay. At this point, we have concluded all requests for member states for the floor. I return to Madam Chair.
Thank you very much. I now give the floor to Dr. Bruce Elwer. Dr. Elwer, you have the floor.
Madam Chair, Excellencies, delegates, ladies and gentlemen, on behalf of the World Health Organization and the implementing partners of the ACT Accelerator, which includes all of our international organizations, our industry partners, civil society partners, and of course, your member states, I'd like to express our appreciation for the recognition of the work of the ACT Accelerator and COVAX, as well as the statements of support as we move forward. Indeed, as one delegate put it, we here at WHO see the success of the ACT Accelerator and COVAX as the exit strategy from the pandemic going forward. And WHO's role, of course, as many of you highlighted, central to that across so many of the elements that were discussed. I'd like to speak to 5 points very briefly. First, we appreciate the emphasis on the full package of interventions. We heard the message loud and clear about the support on oxygen, which of course is a priority. Also on diagnostics, not just to manage the response, but also to open economies, open societies as we move forward. I'd like to reassure those delegates who asked that the research agenda on therapeutics, as Mike alluded to, and our chief scientist, Dr. Swaminathan, that research agenda is very much alive within the ACT Accelerator and beyond to try and ensure we do have therapeutics that can help both to save lives and prevent the progression of infection or even infection itself moving forward. On the second issue, just to speak to briefly on vaccine rollout, We appreciate very much the statements and commitments to share doses, especially those to share doses through COVAX and to advance the sharing of doses to the later this month and June, July, because this is the crucial period in which we're working to catch up to the Director General's challenge of vaccinating at least 10% coverage in all countries by the end of September, en route to over 30% of the population in every country by the end of this year. We appreciate in that regard, of course, the support for the export of vaccines and the raw materials necessary to make them, and of course, the prioritization of healthcare workers and elderly populations or older populations as we move forward. On the third point, with respect to addressing the egregious coverage and availability of vaccines in low-income, low-middle-income countries, which currently stands in many areas at less than 1%, we are, as you heard from the representative of Gavi and the COVAX facility, working across multiple dimensions to improve supply through COVAX in the near term. Most importantly, we are looking to bring forward as many of our supplies as possible. We are working to diversify the portfolio, as was requested by a number of member states. We are also looking to accelerate not just the scale of donations, but also the timing of dose sharing so that, again, we can catch up as rapidly as possible. There are a number of comments about the importance of local production, and I would like to assure you that also is a priority of both the World Health Organization, its COVAX partners, and beyond. We have established a task force within COVAX for the expanded production of vaccines that looks across the spectrum of increasing the supply of raw materials, increasing fill and finish, and even establishing, of course, new production facilities, particularly in poorly served or underserved areas. That, of course, is led by our chief scientist from the WHO side, Dr. Swaminathan. There was a specific question with respect to the expression of interest for the establishment of mRNA vaccine transfer or technology transfer hub. And I just would remind member states that the call for expression of interest was issued on the 16th of April. It will close in early June. At this point, we have received 18 offers from countries in 12 countries in 5 WHO regions to either provide mRNA technology or to host a tech hub or both. And we have also had, in addition, 21 expressions from 5 regions of interest to receive that technology, again, all under the leadership of our chief scientist, Dr. Swaminathan. In addition, of course, we are working hard to accelerate the emergency use listing of additional products to help diversify the portfolio of EUL products, work that is led, of course, by Dr. Mariangela Simao, our Assistant Director General for Medicines, and her team. There are other challenges we heard facing middle-income countries in particular with respect to INL, no-fault compensation. We've heard that loud and clear, and we'll work with you on that moving forward. The fourth issue we heard, and the emphasis just recently from Norway, on the need to ensure all doses are put to good use. And indeed, we're already seeing challenges with uptake as we move into adult populations with complex vaccines in some cases. And we are working with countries to try and help solve the problems around in-country financing, workforce expansion, pharmacovigilance, and vaccine confidence and hesitancy, most importantly, as we heard a number of times from you, our member states. The last issue I'd just like to speak to briefly is that challenge as we move forward. We really very much appreciated the comments that the challenges in front of us to see the ultimate success of the ACT Accelerator and COVAX are really financial and political support challenges, as the Director General spoke to and you, a number of our member states, highlighted. In this regard, I'd just like to take a moment to express our appreciation on behalf of the Director General and the entire ACT Accelerator Consortium to His Excellency President Ramaphosa of South Africa and Her Excellency Prime Minister Solberg of Norway, who serve as the co-chairs of our Facilitation Council that works to grapple with those financial and other challenges which hold back the full promise of the ACT Accelerator, for which we are now making progress thanks to their leadership. Finally, in closing, just like to refer back to one of the comments that was made by one of our delegates about the importance of ensuring we have no white spots rather on our maps going forward. And indeed, that is our intent, not just with vaccines, but indeed all tools. And we especially appreciated the comment, I believe it was from Paraguay, of the need to vaccinate on both sides of the river. And indeed, that is our commitment to you, the member states, to do everything possible to ensure you have the tools to vaccinate on both sides of every river in every country and between every country as we move forward. To do that, we need, as the Director General called for in his opening remarks, the full financing of the ACT Accelerator, its $18.5 billion gap for this year, most immediately. We need the immediate sharing of doses through the COVAX facility to optimize equitable access. And we need sharing of doses to reach 250 million people over the next 4 months by end of September. We need the scale up of manufacturing, of course, and we're working across a huge number of countries in that regard. And finally, of course, we need the full support for WHO's SPRP, because at the end of the day, that is what anchors the work of the ACT Accelerator and ensure it translates from products into actual saved lives, reduction of transmission, and an exit from this pandemic. Thank you.
Thank you very much, Dr. Orwell, for your words. This concludes our discussion on this topic. We will now move to the third and final grouping: World Health Organization's work in health emergencies and strengthening preparedness for health emergencies and mental health preparedness for and response to the COVID-19 pandemic. The relevant documents are A17-4/9, A74/10 Revision 1. Could those delegates wishing to speak please raise their hands on the Zoom platform? I would now like to give the floor to the moderator to manage the list of speakers.
Thank you, Madam Chair. I now give the floor to the Bahamas, to be followed by Sri Lanka.
Madam, the Bahamas commands the work of the Executive Board in placing a spotlight on the issue of mental health once again. The Bahamas remains committed to improving the services that are provided in the prevention and management of mental health issues at all levels. While significant work has been achieved in the strengthening of clinical resources in the training and recruitment of mental health nurses and psychiatrists, there remains a need for the design of a mental health services construct that maps out the types of services available in country, the training and skills provided in the various spaces, the gaps that remain, and the strategic plan to improve the provision of mental health services. Several initiatives have been stalled due to the need to respond to the natural disasters caused by Category 5 hurricanes, and more recently, the COVID-19 pandemic. Nevertheless, there remains recognition of the need to intentionally pursue a mental health strategy that straddles existing primary care and tertiary care connection so that it becomes interwoven with a package of health service delivery. Madam Chair, the Bahamas fully endorses the 3 recommendations in the documents as they reflect aptly both the strategy moving forward and the work underway in strengthening our mental health capacity and services. We look forward to the information and educational materials and other media assets that will assist in increasing the awareness of the importance of seeking and preserving good mental health. Thank you.
Thank you to the Bahamas. I now give the floor to Sri Lanka, to be followed by the World Federation of Public Health Associations, joined by their constituency members.
Thank you, Chairperson. Sri Lanka hereby support the zero regional and one voice proposed by Bangladesh on item 18, mental health preparedness and response to COVID-19 pandemic. Having recognized the significance of psychological distress and the rights of persons and families affected by emergencies in order to improve their quality of life, Sri Lanka urgently and greatly committed to take concrete steps in several areas. Sri Lanka has many achievements during this pandemic to alleviate the sufferings of people due to the impact of COVID-19 pandemic. They are targeted towards the well-being of frontline workers, addressing psychosocial distress among general public, with special emphasis on people who are quarantined, setting up of centers for persons with mental disorders and drug dependents who are COVID positive, home delivery of medications, special clinics within isolated areas while maintaining the routine services, a guideline for primary care physicians to manage mental disorders is noteworthy. Substance abuse consequent to an emergency is a notable area to which a countrywide capacity building training have been conducted. Information generation in order to take future informed decisions are being implemented. Chairperson, we would be happy to propose the Assembly to develop and further strengthening of collaborative mechanism among multi-stakeholders and a sustainable monitoring mechanism for comprehensive and coordinated actions to enhance the mental well-being of people under the following three broad actions as mentioned in the UN Policy Brief 13 May 2020. We expect this Assembly to provide technical support for the member states to facilitate this process. Number one, a whole of the society approach to promote, protect and care for mental health. Two, ensure widespread availability of emergency mental health and psychosocial support. Number three, support recovery from COVID-19 by building mental health services for the future. Thank you, Chairperson.
Thank you, Sri Lanka. We will be mixing member state statements with NSA constituencies as per the hands raised. Several constituencies of non-state actors in official relations with WHO have requested the floor on this grouping of agenda items. According to the privileges conferred by relationship with WHO, I have the pleasure to give to the floor to the constituency of non-state actors presented by the World Federation of Public Health Associations, joined by constituency members, the International Federation on Aging, the International Hospital Federation, the International Physicians for the Prevention of Nuclear War, World Organization of Family Doctors, World Federation of Occupational Therapists, and International League of Dermatological Societies. The World Federation of Public Health Associations, you have the floor, to be followed by Senegal.
And dear members of the Assembly, my name is Bettina Boresch, CEO of the World Federation. Our constituency, consisting of major international federations of global health, primary care, and social work professionals supports the WHO in its call on its member states to work together on the co-design and co-production of coordinated strategies to control the pandemic. Where countries have struggled to implement effective COVID-19 control, the political leadership has often undermined the critical role of skilled frontline professionals. The greatest success has been achieved between the government, professionals, trade unions, and communities working together with a high level of mutual trust. Where this has occurred, there has been an important increased control of the virus, allowing countries to resume freedoms and functional economies. We call on WHO and its member states to take action to ensure that treatments and vaccines are available to everyone, everywhere. This requires establishing multidisciplinary engagement with local up to cross-border social protection systems to reach all people. We call WHO on to transform COVAX into a COVID-19 solidarity pooling platform, enabling knowledge sharing as well as boosting production capacity under a public health-driven alliance of vaccine manufacturers dedicated to research, development, manufacturing, and supply of high-quality, efficient, safe, and sustainable vaccines and treatments. We call upon WHO to increase preparedness, including health literacy, while decreasing vulnerability to future pandemics through reducing health and social inequalities that have undermined the current interventions in controlling this pandemic. And lastly, we call to establish a clear partnership between the politicians and the health, social, and trade unions professionals to build public trust and engagement. The coalition stands ready and committed to fully utilize the skills, networks, and competencies in supporting WHO and its member states to advance these solutions. We call on member states to build their strategies on the human rights-based approach to guarantee equal access to the highest attainable standard of health.
Thank you to the World Federation of Public Health Associations. Your time has now elapsed. As requested, we will continue mixing the member state statements with the NSA constituencies. I now give the floor to Senegal, to be followed by Cambodia. Senegal, you have the floor. I now give the floor to Cambodia, to be followed by, oh, thank you, Senegal. I see you on the screen. Please come in. Senegal, can you hear us? It appears we are experiencing technical difficulties. Senegal, we will come back to you. I now give the floor to Cambodia, to be followed by the Republic of Korea.
Go ahead. Okay. Excellency Chair, distinguished delegates, ladies and gentlemen. Cambodia is committed to integrate mental health services into the different levels of care across the health systems. We focus on strengthening the primary health care, such as the role of the health centers, in line with the WHO recommendations and mental health global action plan. We are in the process of developing a 5-year strategic action plan for mental health and substance abuse for 2022 to 2026 with WHO technical support. We aim to ensure its effective implementations and make mental health services more available to Cambodian people, especially in the context of COVID-19 pandemics. The COVID-19 pandemic has impacts on essential health services in Cambodia, including mental health and psychosocial support. In response to the health and social economic challenges, the Ministry of Health, in collaboration with the UN agencies, including WHO's, IOM's, UNICEF, and UNFPA's, has adopted a whole system approach covering communities, village health support group, health center, and referral hospitals, as well as rehabilitation facility staff, to enhance the quality of health services delivery on mental health and psychosocial supports. As a result, a rank of key stakeholders across the country has gained knowledge and skill on mental health and psychosocial support in response to COVID-19. This includes more than 2,000 health staff from health center and district referral hospital, and more than 600 frontline COVID health staff and health officials of the Ministries of Health, Ministries of Defense, medical volunteers. The Ministry of Health is making effort to integrate mental health and psychosocial support into the existing hotline of 115 at the quarantine centers. At the community levels, awareness-raising sections on mental health and psychosocial support were conducted for villages and village health support groups, and awareness-raising materials on COVID-19 related anxiety and depression management, suicide prevention, and basic psychosocial support and relaxation were produced and distributed among the populations. Additionally, virtual training on mental health and psychosocial support were conducted for Cambodian Red Cross staff. And the operation guide on psychological first aid in school were developed and endorsed by the Ministry of Education, Sport for implementation at school. The COVID-19 pandemic response provides an opportunity for strengthening health system for the future. The Ministry of Health is making its effort to transform mental health service delivery within the overall process of the health system transformation in Cambodia. I thank Madam Chair.
Thank you, Cambodia. I now give the floor to the Republic of Korea, to be followed by the United Kingdom.
Thank you, Madam Moderator. The Republic of Korea would like to reiterate the importance of WHO in emergency response and would like to thank the WHO for its efforts. And in this regard, Korea stands firmly with the MICTA statement on COVID-19. On this occasion, Korea would like to elaborate on the issue of mental health. Prolonged social distancing measures have led many people to suffer from stress and depression. Aimed to address this COVID-19 blues, the Korean government established the National 5-Year Mental Health Plan this January to enhance mental health of all Koreans. This plan expands non-face-to-face psychological support services via mobile apps and social networking sites, and strengthens outreach health services like the Mental Health Ambulance Program. The Republic of Korea remains vigilant against the exacerbation of existing mental health conditions and is striving to make mental health services universal. Also, in line with the recommendation given by the updated Mental Health Action Plan for 2013 to 2030, the Korean government mapped out the budget plans for our national plan for the next 5 years in order to ensure that it is concrete and realizable. Considering that demand for mental health services will remain high after the pandemic, a total of approximately $1.8 billion will be invested in post-COVID-19 mental health measures, which will be used to expand community-based mental health services and strengthen early intervention and treatment to prevent serious mental illnesses. In addition, the Republic of Korea will expand research and development to enable systematic research on COVID-19's impact on mental health. We are planning a 6-year panel study to assess COVID-19's impact on mental health and will identify factors affecting individual, social, and collective mental health while developing psychological support and early intervention technologies. As mentioned at the previous executive board, it is necessary to share each country's face-to-face and non-face-to-face mental health policies, as well as socio-psychological policies for the general public and people with mental illnesses. We hope that such forum of discussion could be convened by the WHO. On that note, the Republic of Korea endorses the updated and comprehensive mental health action plan that takes COVID-19 responses and recovery processes into consideration. We sincerely hope that people all over the world could remain physically and mentally healthy as we combat COVID-19. Thank you.
Thank you to the Republic of Korea. I now give the floor to the United Kingdom of Great Britain and Northern Ireland, to be followed by Fiji.
Thank you for the papers and presentations. The UK has been a strong advocate for the World Health Emergencies Programme since its very inception in 2016. The programme has achieved a huge amount in its first 5 years, saving countless lives and stopping dozens of health emergencies in their tracks. COVID-19 has demonstrated, however, that we must go further and faster in strengthening global preparedness for health emergencies. Indeed, to prevent the next pandemic, the UK believes that we need a paradigm shift with a strengthened WHO, new legally binding obligations for member states with the means to ensure compliance, including for the IHR, and adequate, sustainable financing for pandemic prevention and preparedness. That's why the UK strongly supports the resolutions being adopted by this Assembly today. The WHO's strengthening resolution contains no fewer than 65 operative paragraphs, laying the foundations for immediate reform in all the most important areas, from One Health to the Emergency Committee, and from alert systems to peer reviews. It rightly calls upon member states as well as the WHO to strengthen preparedness. We commend the European Union for its stewardship of this enormous piece of work, and we look forward to getting started together on implementation in the working group established by the resolution as soon as this Assembly concludes. The UK believes that in the longer term, we must go even further to deliver this paradigm shift that we need. That's why we have worked so closely with Chile, the European Union and many other partners to bring to this Assembly a decision relating to a new pandemic treaty or convention. We'd like to thank delegates for their constructive and committed approach to the discussions in this area, which have enabled us to agree to hold a special session of this Assembly in November focused specifically on this issue. We align with the joint statement on this decision by our South African colleagues. We also welcome the resolution on mental health preparedness and commend Thailand for its leadership on this important issue. On the Health Emergencies Programme, at previous governing bodies, we have flagged the need to strengthen functional capacities, including HR, deployment processes, administrative and reporting capabilities, and increased capacity in priority countries facing emergencies. The ongoing commission examining sexual exploitation and abuse in the DRC highlights the increased risk of such issues in the context of emergencies and conflict. The WHO's systems in emergencies and in all its work must be fully equipped to prevent and respond to these abuses. As we've heard from the reviews, the requirements on the emergencies programme have grown exponentially, while its budget has grown only incrementally. That is unsustainable. The programme must be sufficiently funded if we expect it to protect us all from health threats. That's one reason for the UK's significant and fully flexible core contribution, and we encourage others to continue to invest in this vital collective endeavour. Thank you very much.
Thank you to the United Kingdom of Great Britain and Northern Ireland. I now give the floor to Fiji, to be followed by Angola. I see that Fiji has now removed their hand and would like to take up this intervention at a later point. I give the floor to Angola, to be followed by the World.
Thank you. We consider that COVID-19 pandemic was the most important test for the application of the international health regulation. The implementation of the recommended action was a great challenge due to the speed of disease spread, insufficient coordination, and the initial guidelines. More gradually, the national notification of the cases, the capacity for laboratory confirmation, the application of measures at the level of entry point, and general response activities gradually improved.
My apologies, Angola. My apologies for interrupting. We are having technical issues with the sound. Could you kindly come closer to the microphone for the ease of interpretation? Thank you so much.
Undermine the effort of states to control the spread of this pandemic. Since the beginning of the pandemic, the daily feedback bulletin has been regularly disseminated throughout the network of our international concerns, such as yellow fever, being carried out on routine basis.
Dear delegation of Angola, my sincere apologies, but there are sound issues. Could you try coming closer to the microphone or removing your mask if you are socially distant, so that we can ensure that the interpreters are able to pick up the sound? Can you kindly begin your intervention from the beginning to ensure that we can capture it in its entirety? Angola, you have the floor.
Thank you very much, Madam, for the moderation. Angola welcomes the initiative of the Executive Board of Strengthening and Improving the International Health Regulation 2005. We consider that COVID-19 pandemic was the most important test for the application of international health regulation. The implementation of the recommended action was a great challenge due to the speed of the disease spread. The insufficient coordination care initially guidelines was gradually...
Sincere apologies on behalf of the interpreters. The sound quality is unfeasible.
And the general response activities gradually improve. With COVID-19 vaccines already in the market and the others in the process of approval, we hope the concrete actions will be taken to make them effectively available at all countries. Indeed, we firmly believe that without a strong commitment in this sense, the unfair and unequitable access to the vaccine will continue to undermine the efforts of the state to control the spread of the pandemic. Since the beginning of the pandemic, the daily feedback bulletin has been regularly disseminated throughout the network of our national health system. Surveillance for the other diseases of international concern, such as yellow fever, is being carried out on routine basis. Angola agrees and supports the proposal mentioned in the document. Thank you very much, moderator.
Many thanks, and we will be mixing the member state statements with the non-state actor constituencies, as previously mentioned. The World Dental Federation will now take the floor, joined by the constituency members, the International Pharmaceutical Federation, and the World Medical Association, to be followed by Uruguay.
Distinguished delegates, I speak on behalf of FDI World Dental Federation, International Pharmaceutical Federation, and World Medical Association. We are part of a broader coalition of health professionals that represents over 41 million nurses, pharmacists, physiotherapists, dentists, and physicians. Having a strong health workforce is key to supporting the world through any health emergency. We urge member states to heed the Independence Panel's urgent call to take immediate action to stop the pandemic and to follow recommendations to ensure that any future infectious disease outbreak does not become another catastrophic pandemic. In particular, countries must invest in preparedness now and support their health professionals accordingly. On the COVID-19 response, we ask member states to, 1, provide channels for health professionals to have timely access to the latest, accurate, and comprehensive information and guidance on COVID-19, including PPE considerations and on best practices during the pandemic across countries, free from political interference and manipulation. 2, guarantee continuity of essential health services and avoid diagnosis and treatment backlogs. 3, further invest in infrastructure and update regulations for immunization to ensure health systems have the capacity for population-wide COVID-19 immunization and that all priority groups, including health professionals, are given precedence in the vaccination rollout in all countries. 4, acknowledge there is a need to separate science and politics and actively involve health professionals in decision-making. On emergency preparedness, we ask member states to, 1, support a call for expeditiously negotiating an international legal instrument to address future pandemics. 2, set up a funding mechanism to support developing countries in strengthening their health and education systems for future health emergencies, avoiding disruption of essential health services and supplies. 3, ensure that health facilities provide positive practice environments through the sufficient qualified staffing and decent working conditions, including occupational safety, manageable workloads, stress reduction measures, adequate remuneration, and protection from violence, abuse, and discrimination, and provision of psychosocial support and counseling. 4, include emergency preparedness and response, including guidance on PPE use in all health professional education curricula, and ensure continuing professional development. 5, work with health professionals to foster collaboration between professions to strengthen current care delivery and resilience for the future. In addition, we urge member states to prioritize the promotion of mental health and psychosocial well-being in COVID-19 recovery plans and to place a strong focus on those most vulnerable, including health professionals. Thank you.
Thank you to the FDI World Dental Federation and constituency members. I now give the floor to Uruguay, to be followed by Brazil. Uruguay, you have the floor. I understand that we may be experiencing technical issues. We will come back to Uruguay. We will continue with Brazil, followed by Paraguay.
Thank you.
We hear you well.
About the opportunities for making progress on strengthening the WHO in order to allow the organization to fulfill its respective mandate and roles in preventing, detecting, and responding to health emergencies. In this regard, we would like to stress the need to intensify cooperation and collaboration at all levels in order to contain and control the COVID-19 pandemic and mitigate its impact. It's imperative to provide the WHO with the tools and resources it needs to better prepare to protect humanity against public health emergencies through an effective, coordinated, multi-sectoral, and evidence-based public health response. If, on the one hand, we need to make WHO's decision-making process more efficient and to enhance institutional capacity, on the other hand, such processes must be transparent, inclusive, and contextualized to different needs across regions and countries. Regarding item 18, Brazil reiterates its support to the Comprehensive Mental Health Action Plan 2013-2030 and co-sponsors the relevant decision. Mental health conditions affect all areas of life, especially during a pandemic that has demanded relevant individual and social sacrifices from us all. Guaranteeing universal access to mental health services is thus fundamental to mitigate important consequences of COVID-19. There is an ever-growing need to invest in and develop strategies and actions to treat mental health problems, including establishing online services, such as remote medical attention for safe diagnosis and offering full treatment coverage for health workers and other frontline professionals. According to recent data collected by the Brazilian Ministry of Health, there is a drastic increase of mental health conditions among the Brazilian population due to COVID-19, such as anxiety, depression, and post-traumatic stress. To cope with this new reality, Brazil has increased the funding of its psychosocial care network, a specialized service that offers free of charge medical attention for mental health patients through the public health care system. Frontline health workers facing COVID-19 in particular are offered special mental health services through the so-called Tele-PSI project, which provides psychological and psychiatric online support to help them manage stress, anxiety, depression, and irritability. Brazil takes mental health care seriously because the consequences of COVID-19 are not only physical, but also psychological and psychosocial. Thank you so much, Madam Chair.
Thank you so much, Brazil. I now give the floor to Paraguay, to be followed by the World Heart Federation and its constituency members. Paraguay, you have the floor.
Yes. Good day to all. Thank you, Madam Moderator. Thank you, Madam President. The proposal covers the most important aspects related to recovery of member states from the COVID-19 pandemic. It focuses on capacity building when it comes to being able to respond to the challenges that we face with this pandemic and to promote the well-being and mental health. Paraguay supports the proposal. It's a timely proposal, and it will allow us to promote a better response at member state level when it comes to mental health. An essential pillar here needs to be supporting mechanisms that allow for a regulatory framework for mental health services. That way we'll be able to help people to get better care and better treatment in accordance with their needs. Also looking at care at community level and do this in a very inclusive way. We need laws, policies, and national mental health plans that facilitate the implementation of measures and the management of funds dedicated to mental health. This document is extremely relevant since our country is implementing a reform of its mental health system within the special initiative regarding mental health of WHO. We will continue in the implementation of this initiative and will also continue implementing our national plan in response to COVID-19. And we will strengthen proper coverage throughout the country with community-based responses. Thank you.
Thank you, Paraguay. As previously mentioned, we will be mixing in non-state actor constituencies with the member state intervention. interventions. I now give the floor to the World Heart Federation, joined by the constituency members, the Framework Convention Alliance on Tobacco Control, the International Alliance of Patients Organizations, the International Diabetes Federation, the International Society of Nephrology, the World Hypertension League, and the World Stroke Organization. The World Heart Federation, you have the floor, to be followed by Uruguay.
Honorable Chair, distinguished delegates, we, the members of the Global Coalition for Circulatory Health and supported by the NCD Alliance, thank you for this opportunity to jointly address the World Health Assembly on one of the most critical subjects of our time. The COVID-19 pandemic has taken an incalculable toll on the mental, fiscal, and of course physical health of our societies. This past year has united us in facing a truly global challenge, but it has also exposed deep, enduring fault lines and inequities in the population health and health systems of nearly every country represented here today. The WHO's pulse surveys have demonstrated that essential services for NCDs and mental health have been heavily disrupted in almost every member state, but only 18 of these have reported that NCDs are included in national preparedness and response plans. As the chief representatives of the global circulatory health community and patients, we have a unique responsibility to draw your attention to the tsunami of post-pandemic consequences lying in wait. The combined impacts of cardiac complications due to COVID-19 and interruptions to crucial medical interventions and ongoing care for people living with hypertension, diabetes, kidney disease, stroke, and other circulatory conditions, those most at risk of poor outcomes from COVID-19, will almost certainly exacerbate the already huge burden borne by stressed health systems worldwide. We therefore implore you, our partners in health, to urgently address the key risk factors and preventative measures that can help fight the hidden syndemic of non-communicable and especially circulatory diseases and COVID-19. We call on member states to prioritize ongoing prevention, screening, and treatment for circulatory conditions in national COVID-19 response and recovery plans through concerted patient co-creation and collaboration. Increase domestic allocation of resources and develop targeted policies to tackle CVD and NCD risk factors, including the commercial determinants of health, through funding mechanisms such as taxation of unhealthy commodities. Integrate monitoring and data collection on NCD prevalence, comorbidities, and risk factors into measures of pandemic readiness, resilience, and response, and strengthen primary health care to ensure equitable access to essential health services, particularly for people living with NCDs and in low-resource settings. We thank you for your attention and remain dedicated to supporting you in these vital endeavors so that together we may prepare for, and with perseverance, prevent the next global pandemic. Thank you.
Thank you to the World Heart Federation. I now give the floor to Uruguay, to be followed by Kenya. Uruguay, you have the floor. It appears we are still experiencing technical difficulties. We will move forward with giving the floor to Kenya, followed by the Global Health Council and its constituency members, and then return to Uruguay.
Thank you, Chair. Kenya aligns this statement with that which Zambia will present on behalf of the African member states. Kenya is a state party of the IHR and has progressively instituted legislative, regulatory, and policy mechanisms to incorporate the provisions of the IHR. The government priority development agenda on universal health coverage is a critical prerequisite in building the necessary resilience in the health systems and core national capacities to prevent, detect, and respond to public health events. To guide national health emergency policy and investment, the government in 2017 undertook an IHR joint external evaluation which revealed that Kenya had achieved developed capacity for most of IHR core capacity areas. However, it also revealed that additional effort was needed to move to demonstrated and sustainable IHR capacities. As a result, the government conducted extensive and multi-sector consultations with the main stakeholders involved in IHR implementation and subsequently launched the National Action Plan for Health Security, NAFS, in 2019. The challenge that now remains in funding for action plan, which is largely supported by domestic resources and some development partners. Regarding the agenda on mental health, the mental duress and anguish caused by the pandemic has severely affected lives and livelihoods and has had a catastrophic impact on our citizens. Kenya therefore adopted a whole society approach to promote, protect, and care for mental health as an essential component of the national COVID-19 response through various mental health and psychosocial support activities. Under this initiative, social welfare assessments and reintegration of people in quarantine and isolation back to their communities was also supported. Kenya also developed mental health and psychosocial support guidelines for public emergencies and prioritized psychological first aid training for COVID-19 response teams, frontline workers, as well as community health volunteers to strengthen MHSPSS response at all healthcare levels, including the community. Kenya commits to progressively increase access to quality, affordable care for mental health conditions within health and social services as envisioned under the government universal health coverage agenda, and support WHO's commitment to progressively cover 1 billion additional people living with non-communicable diseases and mental health conditions by 2023 with essential health services and medicines. We urge member states to increase investment into management of mental health and request the Director General to ensure that mental health departments' human and financial resources needs are adequately catered for. I thank you.
Thank you. And I now give the floor to the Global Health Council, joined by the constituency members, the International Women's Health Coalition, Save the Children Fund, the Task Force for Global Health, United Nations Foundation, Women Deliver, World Vision International, IntraHealth International, and PATH. The Global Health Council, you have the floor, to be followed by Uruguay.
Thank you, moderator. More than a year into this COVID-19 pandemic, over 1 billion vaccine doses have been delivered globally. Yet, access to vaccines and other life-saving tools has not been equitable. The pandemic has spotlighted health inequities, which allowed the virus to continue to spread, mutate, and overwhelm health systems, leaving marginalized populations further behind. These inequities were not born of COVID-19, and inadequate investment and policy responses risk further widening the gap. We applaud WHO efforts to address inequities through strengthened international cooperation, and we support negotiations to improve international pandemic preparedness. Collective action, with WHO leading the charge, is critical to end this pandemic, achieve equitable recovery, and create stronger, resilient systems. We urge member states to maximize dose sharing through COVAX, fully fund the ACT Accelerator, support CTAP, address barriers to expand vaccine supply, and commit political leadership to oversee response and recovery. We welcome the Director General's update on implementation of Resolution 73.1, which acknowledges COVID-19's contribution to disruptions to essential health services. And we urge member states to increase investment in health systems, including workforce, to ensure continuity and strengthening of services in pursuit of health for all. We need a holistic approach to pandemic prevention, preparedness, response, and health system strengthening. To prepare for future health emergencies, WHO and member states must urgently improve global coordination, increase sustainable financing for preparedness, including through a catalytic mechanism, and invest in better and more effective surveillance systems and field epidemiology training. National and global responses to future health emergencies must include: 1, investment in national leadership positions, multi-sectoral coordination, implemented action plans, and sustained funding to increase global health security to fully reach IHR compliance. 2, prioritization of regional research and manufacturing capacity. 3, strengthened medical and pharmaceutical supply chains in advance of health emergencies. 4, incorporation of pathogen spillover prevention and zoonotic risk assessment. And 5, training and support for a broad range of health workforce cadres. Member states, WHO, and other stakeholders must promote an all-of-society approach to health system strengthening and pandemic preparedness that includes meaningful civil society engagement and addresses inequities at their roots. Building health system resilience requires not only recruiting one—
Thank you to the Global Health Council. Your time has elapsed. I now give the floor to Uruguay, to be followed by China.
Thanks. Good afternoon. Uruguay is grateful for the report presented by the Secretariat on item 18 of the agenda, preparation on mental health and COVID-19. The COVID-19 pandemic has shown more than ever that we are all vulnerable to mental illness. Because in this context, each and every one of us had to live in their own flesh, physical and social distancing. And now we understand that when we talk about mental health, we're talking about investing in commitment, in who we are, regardless of where we are. Over these months of pandemic, we also understood the importance of emotional approaches, which is our central part of any cure. For Uruguay, there is no comprehensive health without mental health. Our country has adopted specific legislation on mental health that has as its main objective to guarantee the protection of mental health for the—
We can hear you well.
Thank you.
Uruguay has adopted specific legislation on mental health that has as its major goal guaranteeing the protection of mental health for the inhabitants of our country with a human rights perspective, especially bearing in mind the rights of those who use mental health services. And this is covered in our national mental health system. Our national health program, adopted in 2020, wants to contribute to the mental health of individuals through the implementation of the most effective strategies to promote mental health of individuals. We also want to reduce the mortality and morbidity of individuals with mental disorders and provide quality care based on a human rights approach that has a communitary and intersectorial focus. The national program involves a change in the care model. It includes the entire society, academia, social organizations, users, the users' families, as well as UN organizations and agencies. this is the way to cure mental disease. We also address things at an educational and as well as in the work context. The comprehensive Program of Action for Mental Health 2013-2030 will also provide psychosocial support, and this is especially relevant bearing in mind the COVID-19 pandemic, and is part of our broader efforts to recover essential services and to maintain the milestones achieved with respect to universal health coverage. Thank you very much.
Thank you, Uruguay. I now give the floor to China, to be followed by Japan.
Thank you, Madam Chair. This delegation thanks the Director General for his report. WHO's work in the field of emergencies to mental health preparedness and response to the COVID-19 pandemic, and appreciates WHO's tireless efforts in responding to multiple emergencies other than COVID-19. The World Health Organization in the field of public health emergency work fruitful. China believes that the world today still has many natural disasters and conflicts. Infectious disease are still occurring in many countries, developing countries. The World Health Organization should give full play to its core leadership, strengthen the 3 levels of the nation, utilize the existing resources, and help the poor countries promote their health emergency core capacity, protect the vulnerable groups such as women, children, and on their mental health. China would like to suggest that the DG's role in pooling the funding should be strengthened. National coordination mechanism should be improved, while the specific should be more detailed. Also, we suggest the developed countries to actively honor their international obligations, fulfill their responsibilities, and play a more important role in protecting One Health. China would like to co-sponsor the resolution proposed by EU and some other member states. Thank you, Chair.
Thank you, China. I now give the floor to Japan, to be followed by the IFPMA constituency.
Thank you, Madam Moderator. We appreciate the Secretariat for an insightful report with data. Japan supports the resolution on strengthening the WHO and the decision for the World Health Assembly special session as a co-sponsor. It is clear that the WHO's coordination and collaboration WHO's coordination and collaboration with other UN agencies, governments, and civil society is needed more than ever. In this context, we would like to make 4 points. First, given the importance to take part in the international rulemaking to tackle pandemics and other health emergencies, Japan would like to actively contribute to discussion on international instruments. Second, for WHO to play a more leading, convening, and coordinating role in emergency response with independent capability while ensuring other important functions such as providing technical advice and support. We would like to underline the importance of governance. We support a stronger executive board which would work together with the Secretariat hand in hand, recognizing that stronger governance will ensure transparency and accountability. while building a greater leadership in global health. Third, Japan would like to ask the Secretariat to share with member states their views on the future roadmap for various stakeholders to fulfill their roles in health emergencies, while preventing duplication of functions based on recommendations made by the independent panel, the IHL Review Committee, and the IOSC. Fourth, Japan supports the Secretariat's decision on the updated mental health action plan. We resonate with the WHO's concerns about increased anxiety, depression, and stress caused by COVID-19, in addition to exhaustion of medical personnel. For example, we are seeing an increase in the number of suicides among young people nationwide and worldwide. Therefore, Japan began to work on these mental issues. We also appreciate the Secretariat's strong emphasis on suicide prevention, mental health of vulnerable groups across the lifespan, such as children, adolescents, and pregnant mothers, and the mental health of frontline health and social care workers. We are looking forward to new data and future guidelines by WHO for groups with these particular risks. Chair, Japan has been also working on the growing problem of social anxiety, loneliness, and isolation under COVID-19 through a whole of government approach. We are eager to share our lessons and experiences, collaborating with WHO to contribute to global health, in particular mental health. Finally, Madam Chair, Japan is pleased to see this Health Assembly reaffirming our collective efforts to end the current pandemic and to prevent future pandemics. I thank you.
Thank you, Japan. I now give the floor to the International Federation of Pharmaceutical Manufacturers and Associations, joined by the constituency member, Global South Care Federation, to be followed by Australia.
Thank you, Madam Moderator. GSCF and IFPMA, supported by IGBA, welcome the opportunity to make this constituency statement under Agenda Item 17. Innovative health industries continue to remain at the forefront of the global effort to develop and manufacture tests, therapeutics, preventative tools, and vaccines to contain and defeat COVID, and of ensuring these reach people everywhere. This massive and unprecedented effort is moving with tremendous pace. After more than 200 clinical trials and nearly 300 partnerships and collaborations among manufacturers worldwide, COVID vaccine production has increased from 0 to 2.2 billion doses by the end of May, with an astounding estimate of 11 billion doses by the end of this year, enough doses to vaccinate the world's adult population. As Dr. Tedros stated, the private sector has an essential role to play in combating this public health crisis through the expertise, innovation, and resources. That said, COVID vaccines currently are not equally reaching all priority populations worldwide. Immediate action must focus on stepping up responsible dose sharing and maximizing production without compromising quality and safety. Global health challenges such as this require truly inclusive cooperation and a redoubling of efforts to ensuring health system resilience. Manufacturers, governments, and NGOs must work together to take urgent steps to further address this inequity, and the industry recently proposed 5 concrete steps that will deliver in the short term. Those can be found on IFPMA website. We urge governments in coordination with WHO to eliminate all trade and regulatory barriers to export and to facilitate and expedite the cross-border supply of key raw materials, essential manufacturing materials, medicines and vaccines, and prioritize the movement of skilled vaccine manufacturing workforce. We call on member states to ensure that they are ready and able to rapidly deploy available doses and to mitigate the risks to the production and deployment of other vaccines vital to public health worldwide. We also urge governments to guarantee immediate and unhindered access to pathogens and associated information regarding any COVID variants to support the development of new vaccines and treatments. It is important that the world uses the lessons we have learned during the COVID crisis to make sure we are all better prepared in the future. Industry is committed to delivering preparedness solutions and to contributing our expertise to relevant discussions. We look forward to being included in the design of the potential pandemic treaty or other international instrument, and in playing a meaningful role in shaping the future so we are stronger together for the next health emergency. Thank you.
Thank you, IFPMA and its constituency members. I now give the floor to our chair for an announcement, after which we will continue with member state interventions.
Delegates, with your permission, I would like to seek the indulgence of the interpreters to allow us to extend our meeting today by an additional 20 minutes to help us move forward on this agenda item. That means that we close at 17:26. Are you okay with that? Thank you very much. I see we have the agreement of the interpreters, and thank you very much for your amazing work. So now I return to the floor to the moderator to continue. Thank you.
Thank you, Madam Chair. I now give the floor to Australia, to be followed by Norway.
Thank you, Chair. The COVID-19 pandemic continues to cause devastation and continuously reminds us of the importance of mobilising collective action. Australia is standing with our neighbours to prevent and respond to disease outbreaks and support the recovery from COVID-19. Australia has provided $623.2 million to assist countries in the Pacific and Southeast Asia to access COVID-19 vaccines through our Vaccine Access and Health Security Initiative to provide vaccines and comprehensive end-to-end support, and the Quad Vaccine Partnership, which aims to provide over 1 billion vaccines to the Indo-Pacific by 2022. This builds on our contributions to the COVAX facility's advanced market commitment, which has distributed already over 12 million doses to Southeast Asia and the Pacific, and our commitment to share our national supply with our neighbours in the region. We now need a plan setting out priorities and clear actions to direct the implementation of reforms by member states and the WHO in the immediate and longer term. We support the IHR Review Committee's recommendations focused on countries strengthening the integration of IHR core capacities within the broader health system and essential public health functions to improve emergency preparedness, surveillance and response. Australia continues to support our neighbours to strengthen our region's public health capacities, including by providing technical assistance and in-country deployments to support health emergency response coordination, laboratory strengthening and disease surveillance. A strong emergency response delivered by strong health systems is vital if we are to achieve the Sustainable Development Goals. Recognising that monitoring and evaluation enhance implementation, we also support recommendations to strengthen country preparedness through peer review systems and transparent reporting. We would welcome a further update from the WHO on the trial of the Universal Health and Preparedness Review. We strongly endorse the importance of enhancing One Health approaches as recognised across all the review reports. This includes taking a global approach to reduce the risk of future zoonotic disease transmission. We must address high-risk interactions between humans and wildlife that give rise to zoonotic pandemics and also their environmental drivers, such as urban encroachment and wildlife habitat loss. effective governance of One Health across multiple UN agencies, and focus on reducing health threats to human populations will be critical. As part of our collective efforts to enhance the global pandemic preparedness, Australia is pleased to co-sponsor the resolution and the decision point on strengthening WHO preparedness and response to health emergencies, to take forward the recommendations in the independent review reports, and to engaging in working groups to take forward reform efforts. Finally, Australia endorses the updated Comprehensive Mental Health Action Plan 2013 to 2030. This pandemic has had far-reaching consequences on mental health, and we must act to respond. Thank you.
Thank you, Australia. I now give the floor to Norway, to be followed by Canada.
Thank you, Chair. The COVID-19 pandemic has demonstrated that the world needs WHO to coordinate the global response to health emergencies. To deliver on this expectation, WHO's capacity to coordinate and respond must be strengthened. This is why Norway has supported the WHO Health Emergency Programme since its inception. We have also consistently supported the Contingency Fund for Emergencies to enable WHO to be prepared for responding to new crises. We believe this is the most effective form of assistance. 5 years ago, the Security Council adopted Resolution 2286, recognizing that attacks on healthcare was a growing challenge in conflicts. Unfortunately, the trend of destroying health systems and denying the civilian access to basic life-saving services has continued. Lack of respect for and weak implementation of international humanitarian law by parties to conflict is a challenge. We must invest in better protective measures in emergency operations at all levels, including community engagement, acceptance building, and ensuring quality of healthcare. WHO has an important role to play in providing data which can be used by all relevant stakeholders to address the different facets of attacks on healthcare. Mental health is one of the most neglected areas of health, in particular during emergencies. Ensuring that mental health services are provided as part of primary healthcare is not less important during the pandemic. We need to rethink the measures needed to ensure services for some of the most vulnerable groups in this crisis. In Norway's strategy on NCDs, in the context of our development policy, we put a special emphasis on action related to mental health. Norway supports to include mental health in the public health work, thus strengthening quality of life in the population, also during times of crisis. For the most vulnerable, including children and youth, providing accessible services during the whole crisis should be a strong priority to prevent the deterioration in their health condition and an increased need for post-pandemic services. Thank you.
Thank you, Norway. I now give the floor to Canada, to be followed by Indonesia.
Making this action plan timely and robust. The updates to the targets for implementation are a significant step to accelerate good mental health for all. To achieve these goals, we need to commit to transparent and regular reporting on our progress. The updated action plan comes at a crucial moment as the international community begins to consider what it means to build back better in light of COVID-19. The pandemic has highlighted the need for additional global and national action on mental health, including strengthening health systems and psychosocial supports. Now is the time for member states to translate words into action and make progress on the implementation of the updated action plan and its associated targets. This will help get the world back on track to achieve the SDGs, including those related to universal health coverage and as part of efforts to build resilience for future health emergencies. Finally, it is paramount that we engage communities and populations in our efforts, because their insights can help us develop more responsive and innovative approaches. This global momentum on mental health is heartening. Our challenge now is how we can build on this momentum and enhance our efforts together. Canada looks forward to working with all partners in supporting progress against the action plan. Thank you, Chair.
Thank you, Canada. I now give the floor to Indonesia, to be followed by Israel.
Thank you, Chair. Indonesia aligned itself to the statement that will be delivered by Bangladesh on behalf of the 11 share member states on mental health. The COVID-19 pandemic has affected the mental health and psychosocial well-being of our people. This includes health and care workers, frontline workers, and those in vulnerable situations, as well as those with pre-existing mental health conditions. Fear, uncertainty, and anxiety over the development of the pandemic calls for strengthening mental health and resilience. This could be done through an inclusive, multi-stakeholder approach involving different professions related to mental health. It is also important to do early detection of mental health issues in the community. In this regard, we welcome the steps taken by the WHO in mitigating various aspects of the COVID-19 pandemic, which have spilled over into various aspects of health, including mental health. Chair, as has been highlighted many times during the assembly, COVID-19 has showed various weak links of the global health system. We need to transform the global health system to allow it to be more resilient towards the next unpredictable public health emergency. We take note of the new initiatives conducted by the WHO in the context of strengthening preparedness for health emergencies. Indonesia can support such initiatives, and their implementation should respect the principle of equity, equality, and transparency. Indonesia supports exchange of experience and lessons learned to promote accountability and improve global preparedness and response system, including compliance to the International Health Regulation 2005. Therefore, Indonesia has volunteered to be involved in the Universal Health and Preparedness Review Initiative. Indonesia recognizes the need for a whole government and whole society approach to improving global public health preparedness, and that it requires the support and highest political commitment. In closing, Indonesia supports the resolution on strengthening of WHO emergency and preparedness and look forward to contribute meaningful at the open-ended working group to discuss further on how we can strengthen preparedness and response. In this regard, Indonesia would like to confirm our co-sponsorship of the resolution. Ending the pandemic should be our collective objective.
Thank you, Indonesia. I now give the floor to Israel, to be followed by Zambia.
Many thanks. Israel has a novel called Sorbald, which is very interesting to read. Let me read an excerpt for you. It's a special bird that is a guardian of all our feelings. It absorbs our fears, our hopes, all our emotions. It also tries to help us transform all of these emotions into positive actions. We try to teach our children and hope that this bird will protect their souls. This has also been our approach here at the WHO for Israel. This is why it's so important to focus on mental health for our country. We're also very much attached to universal health care, and we think mental health should be part of that. For a long time, mental health has been a sort of side issue at the WHO. We really appreciate the fact that the WHO is now coming to the forefront of our discussions. I think that we should keep this as a priority activity here at the WHO. Indeed, mental health has not been an issue even before the pandemic, but now as we are entering into the first year of this terrible scourge, we see that mental health has become even more important amongst our priorities. We hope that we will be able to provide the best mental health care possible. In Israel, we are trying to adopt a holistic approach to mental health. This will include work, leisure activities, and so forth. All our services have continued to work even during the lockdown to ensure mental health in our country. We want to ensure that we're ensuring that mental health is part of our national program. Please make sure that this important issue is highlighted throughout the work moving forward.
Thank you, Israel. I now give the floor to Zambia, to be followed by Bangladesh.
Thank you, Chairperson. Zambia is honored to deliver this statement on behalf of the Africa region. The Africa region commends the efforts highlighted in the reports contained in the reference documents and other initiatives. We are, however, concerned with the current global response to the COVID-19 pandemic that has fallen short on aspects of global solidarity, despite commendable efforts by WHO to support a coordinated global response. The accelerated R&D efforts for vaccines have not been supported with mechanisms for ensuring equitable and timely access by all countries, resulting in enormous access challenges in developing countries. While we appreciate the areas of focus of interventions by the Secretariat contained in the report, we note that some aspects of Resolution WHA 73.1 are not addressed. The report avoids any discussion on critical challenges that member states, particularly low middle-income countries, face, such as ensuring adequate, affordable, and sustainable supplies of commodities for COVID-19. The resolution specifically requests the Director General to identify and present options, including through the use of the flexibilities in the WTO TRIPS agreement for scaling up development, manufacturing, and distribution capacities needed for transparent, equitable, and timely access to diagnostics, therapeutics, and vaccines for COVID-19 response. Further, it does not provide any information on the work done, if any, by WHO in this regard. It is critical that this aspect of the resolution is urgently and effectively addressed. We therefore request the Secretariat to report on the current status on the availability and access to vaccines for developing countries, the challenges faced by COVAX, options to overcome those challenges, including alternative options that make use of TRIPS flexibilities. Secretariat should also report on the existing regulatory approval pathways for vaccines and the support that they can provide to member states, especially developing countries. In addition, we request Secretariat to establish a time-bound experts working group to consider the existing technical and scientific evidence on vaccines currently under development or in the pipeline, and establish an abbreviated regulatory approval pathway for non-originator vaccines to support local manufacturing of vaccines approved for COVID-19 by other vaccine manufacturers, thus scaling up their supplies. The Africa region creates a call for immediate global action coordinated by a strengthened WHO to ensure that COVID-19 diagnostics, treatments, and preventive products are made available to all member states, and that all knowledge and inventions, including for medical devices, be treated as global public goods. On the IHRRC, we recognize the efforts by the Secretariat in ensuring the impartial, independent, and comprehensive evaluation work of the Review Committee on the Functioning of the International Health Regulations 2005 during the COVID-19 response, endorses its report and urges the full implementation of recommendations contained therein. On mental health in COVID-19, we endorse the updated Comprehensive Mental Health Action Plan 2013-2030, including the WHO Special Initiative for Mental Health. Given the need to support recovery from COVID-19, we request the Secretariat to support member states in promoting mental health and psychosocial well-being and strengthening preparedness, response capacity, and resilience for future public health emergencies, taking into account context-specific solutions that support individual and local community mental health and well-being. In conclusion, the Africa region supports the adoption of the draft resolution introduced by the EU delegation on this agenda item. Chairperson, I thank you.
Thank you, Zambia. I now give the floor to Bangladesh, to be followed by Spain.
Thank you, Madam Moderator. Bangladesh is delivering this statement on behalf of 11 member states in the Southeast Asia region. We appreciate WHO's contribution and leadership in global mental health initiative, particularly in Bangladesh and Nepal, to enhance access to inclusive, integrated, evidence-based primary and community mental health services and psychosocial support. It is a fact that mental health is still the most neglected and underinvested area across WHO program. We hope the EB 148 decision on promoting mental health preparedness and response for public health emergencies would pave the way for strengthening capacity of the member states on mental health preparedness and response to public health emergencies as highlighted with the COVID-19 pandemic. The COVID-19 has exposed the existing mental health service gaps. In this respect, our region would like to make 4 points to address the existing and emerging challenges. First, prioritization of mental health needs to be continued at all levels, global, regional, and national, to ensure an effective and comprehensive response to the mental health needs of people and healthcare workers during COVID-19 pandemic. At the country level, integration of mental health services into primary healthcare needs to be ensured to improve availability and accessibility of mental health care for all, especially those in vulnerable situations and hard-to-reach areas. This also includes promoting deinstitutionalization towards community-led mental health services and care. Moreover, the sustainable funding for addressing mental health problems needs to be available and adequate at all levels. In addition, culturally acceptable norms of mental health services should be developed, keeping in mind the needs, contexts, and priorities across regions. Second, monitoring systems, including research, should be conducted to better understand the magnitude of problems, situation of unmet need, and utilization of services, as well as impacts to patients and family in the event of health emergencies. Third, mental health and community resilience should be strengthened through implementing an inclusive, multi-stakeholder approach involving different professions related to mental health in line with WHO's approach to mental health and psychosocial support. In addition, mental health literacy and awareness must be promoted to reduce misconceptions and stigma about mental health disorders, including in times of health emergencies. Also, adequate technical assistance should be provided for training and building capacity of the community health professionals and social workers on mental health, particularly in low and middle-income countries. Finally, member states should be provided with adequate support for the implementation of the Global Mental Health Action Plan 2013-2030 in the context of public health emergencies. Thank you.
Thank you, Bangladesh. I now give the floor to Spain, to be followed by Portugal. Spain, you have the floor. Spain, we are not able to hear you. Can you come closer to your mic?
Spain supports the statement made by the European Union and supports the decision to promote mental health preparedness for a response to the COVID-19 pandemic. Mental health has always been a priority for my country, and we've not lost sight of it in the current crisis. We need to change the situation into an opportunity by laying the foundations for better mental health and more quality mental health services after COVID. I'd like to take advantage of this opportunity to express the need to provide mental health support to health staff that have gone through a period of extreme stress during the pandemic. Similarly, we want to recognize the impact it's had on certain vulnerable groups that should not be left behind. We can say that Spain, thanks to the resilience of our healthcare system and universal health coverage, as well as access to mental health, has not been interrupted significantly over this period. New demands have led to new modes of organization, and we've also been able to find new resources such as remote medical assistance and health assistance. We're working on a comprehensive approach to mental health, which is why we are updating our national strategy. We're working on the basis of consensus and cooperation, and for that, we also count on the support of individuals that work with organizations. This update is in accordance with the recommendations that are included in the European Mental Health Action Plan. Thus, it is that our new perspective is based on the rights of citizens, social integration, the fight against stigmatization, prevention of suicidal behaviors, and rehabilitation of individuals. We believe that we are laying the foundations for a country to move forward with this paradigm shift, following the guidance of the World Health Organization. We know that this will be the start of better mental health care for all in the future after COVID. Thank you.
Thank you, Spain. I now give the floor to Portugal, to be followed by Denmark.
Chair, Excellencies, I have the honor to address the 74th World Health Assembly on behalf of Portugal. We align ourselves with the previous statement made by the European Union. In the face of COVID-19 pandemic, we would like to congratulate the leading role of WHO and underscore the importance of preparedness, response, and recovery capacities to health emergencies, as well as ever-present need to build resilient health systems. Although we acknowledge gaps which were previously clear on the implementation of the international health regulations, we acknowledge member states for their commitment to multilateral cooperation and international solidarity in supporting countries and the work conducted by the WHO. As such, we highlight the importance of the Universal Health and Preparedness Review, a mechanism with the potential to successfully share policies, technical expertise, and best practices across member states and regions, supporting member states in their individual struggles to scale up preparedness, investment, and improvement. These core capacities should be considered a global public good, especially considering the health, economic, and social disruptions to countries and populations triggered by health emergencies. Chair, we deem timely and necessary to evaluate the experiences lived throughout the first year of pandemic to make sure health system as a whole come out more resilient. We acknowledge the importance of considering these lessons and call on all member states to strive for global equitable cooperation and solidarity in accessing the right tools to fight the pandemic everywhere, as this is our own way to a strong recovery. We are committed to global health security through transparent, reliable, and timely communication in line with the guidance of WHO, assuring global citizens their health and human rights. Thank you very much.
Thank you, Portugal. I now give the floor to Denmark.
Thank you, Chair. Denmark fully aligns itself with the statement made on behalf of the EU and its member states. This statement addresses agenda item 18 on mental health. A good mental health is vital in living life to the fullest, and it cannot be taken for granted. We therefore welcome the updated comprehensive mental health action plan and the proposed decision. It is indeed important and vital to focus on mental health in a time of crisis, such as the current pandemic. COVID-19 itself, as well as applied restrictions and health measures, cause uncertainty and disruption to our everyday life and impact our mental health and well-being. These restrictions and disruptions can be especially challenging for those already struggling with anxiety, social exclusion, or compulsive thoughts. We have to cope and manage the immediate consequences of the pandemic on mental health, but we must not neglect already existing visions or abandon our focus once the pandemic is over. We need to apply the lessons learned from the last year and a half to our future response to health crisis and to our broader mental health management and organization. We must work to eliminate stigma and discrimination while also ensuring the same quality in care, prevention, early detection, treatment and rehabilitation, and follow-up for all mental health disorders as is provided for people with physical illness. In Denmark, we have initiated the implementation of a 10-year mental health plan to address these problems. We need a united focus on mental health, and we should use the current momentum to strengthen our efforts in the future. Thank you.
Thank you, Denmark. I will now return the floor to our chair. Madam Chair, the floor is yours.
Thank you very much. Dear delegates, the General Committee will take place today at 17:30, and we will therefore suspend the discussion on this group of items. 17, Public Health Emergency, Preparedness and Response, and 18, Mental Health Preparedness for and Response to the COVID-19 pandemic. We will resume our discussion on these items at a later stage. When we reconvene tomorrow morning, we will open agenda item 11, Proposed Program Budget 2022-2023, and item 12, World Health Organization Resource Framework, an update under Pillar 4, more effective and efficient World Health Organization providing better support to countries. Please refer to the Daily Journal for full details. I thank you for your extensive interventions today. I wish you a nice rest of the day and look forward to our discussions tomorrow. This meeting is now closed.